ಎಷ್ಟು ಮತ್ತೆ 3 ಬ್ಲಾಕ್ಸ್ ಗ್ಲೌಸ್, ಈ ಪೌಡರ್ ಗ್ಲೌಸ್, ಸಿಂಪಲ್ ಚೀಪ್ ಇದ್ದದ್ದು. ನನಗೇನು ಹೈಫೈ ನಮ್ಮ ಇಲ್ಲಿ ವೆಂಕಟೇಶ್ವರ ಮೆಡಿಕಲ್ ಅದಲ್ಲ, ಇಲ್ಲಿ ಲೆಫ್ಟ್ ಅಲ್ಲಿ ನಮ್ಮ ಪಾರ್ಕಿಂಗ್ ಕೆಳಗಡೆ
Hello, sir. Are you able to listen? Yeah. Okay. Thank you, sir. Sir.
Hello everyone, we will be starting in 5 minutes. We're just waiting for one or two speakers to log in. Good morning, VC sir.
ಹೌದು ಯಾ ನನ್ನ ಇದು ಮಾಡಿದ್ದಾರೆ ಮ್ಯೂಟ್ ಮಾಡಿಬಿಟ್ಟಿದ್ದಾರೆ.
Sir, now we can hear you, sir.
ಯಾ ನೋ ಐ ಕ್ಯಾನ್ ಹಿಯರ್. ಯಾ ಆಯ್ತು. ಮಾರ್ನಿಂಗ್ ವಿಶಾಲ್.
Morning, sir.
ಮಾರ್ನಿಂಗ್.
Hello. A very good morning to all of you, sir.
Morning.
At the outset, I would like to initiate this program by a very brief introduction to the program and get the ball rolling while more people join in. I would like to first of all thank our Honorable Vice Chancellor for giving us this opportunity to have this particular program of Ideathon initiated um, in this particular forum of the Rajiv Gandhi University. I would like to just take a few minutes to tell you all a little brief about this program. The Rajiv Gandhi University celebrates the Foundation Day on the June 1st. And it's also a very special moment because the Rajiv Gandhi University has completed 25 years. Um, it has complete. Gautam, you can mute the slides. Gautam, I will be sharing the screen later. We will be now. I'm just giving a brief introduction. So the Rajiv Gandhi University completes 25 years at this particular moment is from its inception in 1996, and today I think it's a very important day for all of us to have this particular forum being hosted by the Rajiv Gandhi University to initiate this innovation challenge. A couple of points that I want to share with you before we get the ball rolling and have the Vice Chancellor speak to us is I think when we actually discussed with our Vice Chancellor about this, this is something that VC sir had said that he has been envisaging for the last couple of years, and he said this is the time that we should have the youth come together to actually share these ideas. And he actually had a very interesting concept about reverse mentoring. He said the youngsters today are so knowledgeable, they read so much, they are fresh, they are more updated than us in electronics technology. So why not actually have this session where we listen to the youngsters and promote the youngsters to see how they can come up with their own innovative solutions. So I think this particular program today is a milestone that RGUHS has achieved and also inspired the country, being the first medical university to host such an ideathon. What is also interesting that we saw that almost 3 to 4 days of notice to the Prime Minister, when the VC reached out to the Honorable Prime Minister of India, he within a 2-day notice agreed to actually host this program, just reading the contents of the program, just reading the collaborations. Indian Institute of Science, the Indian Institute of Management, IIMB, the Triple IT, Microsoft, DHA, the amount of collaborations that actually was harnessed through this forum was itself inspiring. And immediately the Prime Minister agreed to host this program and spoke very beautifully for 15 minutes. And I was just inspired by one single statement of his. He said that the Rajiv Gandhi University is at its prime youth now. It has just completed 25 years. And it is in this youth that it is coming up with such innovative solutions to inspire other universities also. And I'm sure today we are streaming this live on YouTube. This will become an inspiration for many medical universities across the world to actually encourage and harness innovations. Winston Churchill, long few years back, told a very important line, which I thought is very relevant for today in the COVID times. He said, which is relevant to COVID, he said, it's a riddle wrapped in a mystery within an enigma. And COVID actually epitomizes this. COVID actually is one thing that we have not understood. The WHO has gone wrong. Countries, governments have gone wrong. Nobody has got it fully right. Scientists, virologists, physicians, nobody has got it fully right. So what is it that the youngsters today can offer to us? What is it that they can actually share their ideations to us, their learning to us is going to be a very important learning. And I want to close my remarks with two important points. When VC sir actually initiated this, beyond all skepticism, he gave the core team, and I especially want to take on record Rajesh Shanai sir. See, they gave this particular team the freedom to fail. And they said, don't worry, go on. We are here to back you. And this is what you call the pandemic protocol, that when the leaders trust in their team members, trust in the students, and actually tell them, go ahead, do it, we are here with you. And that is what Vice Chancellor sir, under his leadership, the Registrar sir, and the entire Rajiv Gandhi University team actually encouraged this entire ecosystem to be built today, because of which we are here today to share and learn from our youngsters, learn from our students. And this is by itself a very, very inspiring milestone that RGUHS has achieved today. So with these few lines, I think I want to just also say that when we initiated these applications, there were 1,000 plus applications. And today that has culminated into several teams. My students especially, this is one learning for you from the very beginning, that this is also the time of leadership. This is also the time for you all to learn leadership, how to form teams, how to collaborate. This century, 21st century, is the era of collaboration, not competition alone. So today, one thing that I can assure you from RGUHS behalf is, all of you are winners. Every single person who applied in this is a winner, and RGUHS will continue to do such programs regularly to inspire students. With these few points, I again thank our Honorable Vice Chancellor for giving us all these opportunities. Sir, without you, this entire forum today was a dream. You have made it into a reality, and I pass the mic over to you to speak a few words and guide us further on this. Thank you, sir.
Thank you, Dr. Vishal. That was a very nice introduction to the program and RGUHS activities as well. I welcome all the participants on this webinar. Dear students, faculty, directors of various institutes, jury, mentors, and colleagues. We are living in a moment where the world is facing a huge crisis due to the COVID-19 pandemic. Because besides causing incalculable damage to the world economy, COVID-19 has changed every sphere of our living. It has altered the lives of humans in an unprecedented way, and making us ponder new ways to overcome these challenges. Whenever challenges are thrown at us, we always try to innovate. Rajiv Gandhi University of Health Sciences has organized this Rajiv Gandhi University COVID-19 Innovative Challenge. To make it short, I'll call it as Ideathon from henceforth, to encourage the faculty and students to come up with ideas of finding potential solutions, proof of concepts, prototype, mobile applications, etc., that can help control and curb the present problem. When there was a global hackathon which was conducted, India participated and fared very well. Inspired by this global movement, Hack the Crisis, an India initiative which concluded on April 5th, 2020, received around 15,000 applications and about 2,500 team submissions, which were more than any other country in the world, which means that in India, we have talent, we have potential, we have the zeal to overcome this pandemic. And on similar lines, RGUHS also has conceived this initiative. The boost was given to us when our Honorable Prime Minister Narendra Modi on 5th May 2020, in his address to the nation, has given a call to doctors, scientists, engineers, technologists, and entrepreneurs to come together and find solutions for the present pandemic. Rajiv Gandhi University of Health Sciences is the first health science university to take up this cue and organize this Ideathon. In fact, when RGUHS invited applications for this Ideathon, partnering with the Indian Institute of Science, Indian Institute of Management, Bangalore, IIITB, Bangalore Bioinnovations, HCG, and all the other like-minded organizations in Bangalore, we have received more than 1,000 applications. Out of this, the eminent juries, they did a wonderful job. They have shortlisted around 57 projects, which will be provided with technical guidance from the above mentioned institutions, which I just took the names. These 57 projects will be assigned and classified under 6 domains like health, business, vulnerable population, community, education, and data sciences. We will be allotting mentors to all these selected projects to nurture the concepts and take it forward. We will also arrange and try to find suitable funding agencies to take these projects to their logical end. Presently, Rajiv Gandhi University of Health Sciences has organized this Ideathon to encourage the students and faculty who have got the seeds of great ideas in their minds which needs to be incubated and turn them into fruitful trees. I'm sure that this Ideathon will go a long way in bringing in, new innovative outcomes for control of this pandemic. The 3 best projects selected will be suitably awarded. Such of the applicants who could not make it this time, word of, don't be disheartened. We have arranged webinars to provide training on these aspects today. You can log in and then, listen to them. We are going to invite fresh applications again. We'll do this exercise once again. Please do refine your ideas and concepts and reapply. I wish you all the best. Of course, on June 1st, 2020, Honorable Prime Minister Sri Narendra Modi inaugurated the 25th Foundation Day of and the Silver Jubilee celebrations of Rajiv Gandhi University of Health Sciences and appreciated the initiatives by this university. Since the beginning of COVID-19, Rajiv Gandhi University of Health Sciences has involved in providing training in different aspects of COVID-19 to various groups such as doctors, nurses, allied health science professionals, students, health workers, etc. Apart from this, RGUHS has been involved in framing SOPs, guidelines, and treatment protocols, thereby ensuring uniform management of patients across the state. RGUHS has also initiated applications from its faculty to conduct long-term research in various aspects of COVID-19 disease. We have received so far around 45 applications in this category. We are also planning to have a theme-based research on COVID-19 shortly. This is just the beginning, my friends. We intend to continue many such activities even further. A special mention has to be made about Professor Rajesh Shenoy and his team, Dr. Vishal Rao, Dr. Prashant Reddy and his team, teams from IIITB, IASC, Anita Mahajan, who have continuously put in their efforts in making this Ideathon a realization. I thank the directors and professors of various institutes who have spared their valuable time and energy in making this Ideathon a successful event. And similarly, I welcome all the participants and I wish them all the best. Thank you one and all for being a part of this RGUHS initiative. Together, we will fight against this pandemic. Thank you so much.
Thank you very much, sir, for this, again, an inspiring note that we are going to start this program with. And we want to assure you that we will do our best. And like I told you earlier, the initiation that you have taken is going to be for the years to come, going to be an inspiration not only for this university, but for other universities, other countries, wherein the medical teams will have to be in the forefront of innovation future, and the youngster generations are going to lead the front in new ways. Hopefully beginning a completely new era, the post-COVID era, where we are going to open up the world to a new way of thinking also through this. So the messages that are going to come out of this entire 1,000 ideas are going to, I would again consider it 1,000 ideas, because I believe each one of these ideas have an inspirational potential. And we will come back to you with more updated reports, keep you updated on how these are getting molded in the next months to come. With this, I would give over to Anita Niranjan to initiate the further proceedings. Thank you, Anita. Thank you very much, sir.
Thank you so much.
Good morning, everybody. I sincerely thank our Honorable Vice Chancellor for giving us this opportunity. And thank you, Dr. Vishal Rao, for those good words. Changes call for innovation. Innovation leads to progress. Without change, there is no innovation, creativity, or incentive for improvement. Those who initiate change will have a better opportunity to manage the change that is inevitable. Today, the most inevitable is COVID-19. So here we are with the first of its kind webinar focused on COVID-19 and hosted by a university. Thank you all for being there. We begin our program with our first speaker, Dr. Vishal Rao. Dr. Vishal Rao is speaking on design health thinking. He is a head and neck oncologist, innovator, TEDx speaker, public health, Judy Wilkinfield Award recipient, Om Voice Prosthesis. Presently, he is the Chief of Head and Neck Surgical Oncology and Robotic Surgery at HCG Cancer Center, Bangalore. Dr. Vishal is the inventor of Om Voice Prosthesis, a $1 speaking device for throat cancer patients. He has received wide recognition from BBC, Harvard Business Review, and Forbes. He also serves as editor of Journal of Precision Oncology and has over 100 national and international publications to his credit. Dr. Vishal is an international advisor to the World Health Organization Tobacco-Free Initiatives and is a visiting faculty of Johns Hopkins University Leadership Programs. Dr. Vishal, welcome again, and over to you for your first presentation.
Thank you, Anita. Are you able to see the screen?
Yes.
Okay. So again, Anita, thank you very much. Anita represents the Global Health Academy. She's the managing director of the Global Health Academy, which has been the backbone for this this hosting of the Ideathon. So with this, I think there is some annotation that is going on. Can we just, Bhargav, can you just remove the annotations? Yeah. So I have been asked to, in the next few minutes, speak about design health thinking. So to our students, especially, I thought that this is something that may connect with you effectively.
Sir, just a request. Can you disable the annotate from your screen?
Okay.
There is a setting called the 3-point menu.
Done it.
Disable annotate by the participants.
Yeah. Okay. Is that okay?
Yes, sir.
Okay. So here we go. I will be speaking today about design health thinking, and in design health thinking, I am actually going to focus a little bit about possibility to actuality and how to shape frugal innovations for India. So in the next slides, I'm going to share with you about how do you find a problem, how do you get rid of the problem by finding a solution. My dear friends, I always believed in this, that our responsibility does not lie with what we can do with what is immediately at hand, but it's also to look dimly into the distance, also to look dimly into the future. And that is where the whole philosophy of innovations is important, because the younger generation will have to make way for the future. Now, I often, when I talk about this, I believe the most important thing about innovation is the right problem. Now, the question is, how do you find the right problem? So here, I would like to speak on this entire thing. If you see this entire pictorial, this has got a very interesting story attached to it. There was a cola agent who was actually heading the marketing for the Gulf, and he was asked by his boss to come up with a very innovative solution because they were facing a language barrier. So sitting down one day in one of the restaurants in the 30th floor with his friends, he actually made a proposition to his friend, telling him that he's coming up with an innovative idea. And he came out with a pictorial: a man lying dead tired in the desert drinks a cola and starts to run. He said, this is a simple idea, and this will have every single Arab in the next couple of months with a cola in their hand. He came out with a very aggressive marketing campaign. A month passed by, and a month later, when he met his friend again in the same restaurant, sitting and having a chat over dinner, his friend asked him, so you must be very successful now. I think you must be the CEO of the company. So this man, a little depressed, a little dull, told him, no, you know what happened? Things went wrong. I did not calculate that the Arabs read from right to left. Now the whole interpretation of this thing changed. So it looked like the man was running, drank a cola, and then fell dead in the desert. And this is what often happens when you don't interpret the problem correctly. So it's not just, so what's very, very crucial for us is to understand the problem fully and then interpret it. And today, the Ideathon is going to be one such forum that you're going to be using to actually refine your problems, get the right solution. And remember, my friends, whoever is participating today, The key to the right solution is the key to understand the problem completely, is the key to completely refine your problem. So even today, before the pitch session, as you are prepared, please remember, the more refined the problem, the better the solutions. The other thing that I've always wanted to encourage and tell the students is, remember when Newton saw the apple, he saw the laws of gravity. And when Steve Jobs saw the apple, he gave me my Mac computer. Now, each one of us sees the problem in a unique way. And that is why, when the Vice Chancellor actually gave us these entire topics of health, education, data sciences, community, and things like that, we actually wanted each one of you to look at the solution. So please remember one thing: among all the 1,000 applicants and the 59 teams today, each one of your idea is unique. Each one of your idea is important in its own way. So don't at all at any point in time say that this idea is the same idea, because each one of you can look at it differently, interpret it differently, and come out with more innovative solutions. Now, often people ask you, how do I get a brilliant idea? And this is my simple suggestion to all the participants. Remember that a brilliant idea, like I told you, number one, comes from the right problem. Number two, it also comes from focusing on the patient. Now, remember, whenever you want a good idea, hold on to one patient's problem through your life, and you'll be flooded with good ideas. And I often say this: you don't need to have 100 patients. You will be able to do it in one single patient, but you need to emotionally connect with the problem. You need to actually feel the problem, and that's when you'll be flooded with brilliant ideas. So this is one important thing for all of you, that if you believe in an idea, hold on to it, but hold on to the problem, feel the problem, spend time. So I often tell it to innovators that don't innovate for markets, innovate for individuals, because individuals have a soul to them, and individual ideas can be taken to masses, which can become markets. But if you only focus on a market, you will not be able to come up with more brilliant solutions. So I had worked on one such solution, because I used to see for years, almost a decade, I actually kept watching this problem of throat cancer, and I used to feel frustrated about patients who don't have a voice box, because laryngectomy patients, after they lose their voice box, have a permanent hole in the throat. Now imagine, like all of you who breathe through the nose, this patient breathes through a hole in the neck over here, through which he is able to breathe. So I always believed that speech and communication was a right. And speech and communication was a right and not a privilege. Now, I actually initiated some innovations, because the current solutions were actually costing somewhere around 45,000 to the newer ones costing up to 1.5 lakhs. And there were only two brands in this world. Now, these are extremely good brands, one from US, one from Europe. Both of them very well, very good, but only many of our patients were not able to reach within this ambit. So that is when we actually started working, me and Shashank started working and developing this device, which we called OM. The initial prototype that we developed, we were able to develop it up in just $1. Even today, with all the new rules and regulations and other things, we've kept this entire device the way it is, without royalties. And today we have about 350 patients working with this.
Sir, it is better than earlier speech, and I am feeling comfortable.
Again, my friends, I'm just showing this to you that today about 350 plus patients from across the world are speaking with this. Some who haven't spoken for 10 years, 14 years are speaking with this. And this itself is a simple innovation that transformed lives in a simple way. So today, this is one of the BBC videos that was shared, but I'm not going to, I'll share these links with you later, but BBC actually did a very nice, inspiring video for us on motivating and about how these patients were speaking. I'm going to skip this. So today we have about 300 plus patients who are speaking with this, who have not spoken for 10 to 15 years. And what I want you all to each believe is that, remember, you have the potential to do all of this. And you don't need to become a professor to actually innovate. In fact, your minds are today young, rich, and your minds are today at a position which can process things better than all of us. So please be confident in you. We have a great team of mentors from Bangalore Bioinnovation Center, IIM, from IIIT, Indian Institute of Science, and many other reputed institutes that have come together today. Please take this opportunity to take assistance from all of us. We are all here to support you and guide you. And the one thing that I want to share with you is we are not constrained by the discipline of rigor, but by the limits of the purpose to make a difference. And that's defined by our imagination. So today, Rajiv Gandhi University has given you a platform to extend your imagination and convert it into reality. So remember this, but this imagination should be blended with the purpose to serve people, to help patients. And so, my friends, I want all of you all to think of this, that we need to move from ambition to purpose in life, because all of us have ambitions. We want to be director, chairman, CEO, whatever, HOD. But what about the purpose of life? What about understanding what is the purpose of that particular position? So while you have your ambition, you need to have the purpose. Here I've put two examples here, one of Mahatma Gandhi ji, and another of Mother Teresa, both epitomizing purpose in life. More than ambition, they focused on purpose, and ambition followed. And that is another very important thing. So for all the youngster students here who are participating, please note that purpose is more important than ambition. And the goal of education is knowledge, and the goal of knowledge should be some service to the poor, to the needy, and to the fellow human beings. Another very important thing that I wanted to share with all of you, my friends, is remember that the answer appears when the question is ready and complete. It is like the master who appears when the disciple is ready. So the same way, please believe in your ideas, and remember, the more you refine the questions, the more your idea will take fruition and the answer will appear before you. I that the Vice Chancellor allowed us and gave us the freedom to fail. Similarly, I am telling all of you students here today as a group, the mentors who have come forward, the jury who have come forward, and the Rajiv Gandhi University team that has come forward, have given you the freedom to fail. Don't worry about failures. Remember, the only way to double your success rate is to triple your failure rate. So fail fast, but fail wisely and learn from it. And today, the mentors here are going to guide you in every step, hand-holding you from diagnostics to therapeutics to PPEs to, even if it's the most craziest idea, come forward and share it. And let's see what we can do to handhold you and help you. Maybe this is going to be the beginning of your entrepreneurial journey as a student. And today, there cannot be a bigger endorsement to your effort than the biggest healthcare university of this country coming forward to tell you that they are backing you. I think if this opportunity were to be given to us 2 decades back, it would have been a dream come true. So today you have the possibility in front of you to convert it into an actuality, and we are here to give you the freedom to fail. Don't get hesitant, don't get concerned about the freedom to fail. We are with you, and we are going to support you in every endeavor to actually move forward. And I'm going to leave you with some few thoughts. The one thing that I want to share with you is, remember, whenever we get a good idea, and I'm sure my friend Bindu is here, she's going to talk to you a lot of interesting things about IP. We talk about, moment you get an idea, you want to patent it, you want to protect your idea, and that's very good. You need to do it because brilliant ideas. But there's another important thing that I want to share with you, that whenever we get an idea, we always feel that we own it. I had a very beautiful interaction with His Holiness Dalai Lama in McLeodganj. He told a very beautiful thing. He said that an idea comes to you, not from you. So don't always imagine that you are the owner of the idea. Now, the reason I'm telling this to you is just for one simple thing, that remember that I don't know how many of you all have woken up one morning to just get a brilliant idea that you feel will give you the Nobel Prize, and you Google up and realize that 20 people have already done it. And then you feel bad and say, oh, I didn't realize this. Somebody stole my idea. Now, remember, this is the truth, that ideas are contacting several people at the same time. But it is only a few who are receptive to this idea. It is a few who are excited and then take up this idea and make it into a possibility. So with this, what we did at HCG, we had created a forum of design health thinking, which actually thought about a very interesting forum called Copy Left. I initiated this, my chairman was very skeptical. He asked me, Vishal, are you sure this is what you want to do? And I said, sir, you have to believe in us. This is what we should do. So I created a forum where people can steal each other's ideas. And he said, why would somebody want to do that? And I said, sir, trust in us, let's do this. So the first one that we held about 2 years back, we had about more than 80 participants, many of them enthusiastic to steal each other's ideas. And you know what happened, my friends, after that meeting? After that meeting, we actually had so many people who collaborated, who actually joined together. And you know what happened 3 months later was, the person who stole the other person's idea came back to the person and met him and asked him, can you join hands with me? Because beyond this, I cannot go forward. The truth of this is that a powerful idea is an idea that can be implemented, not of having the idea. Everybody has ideas, but it is only a few of them who can implement it. So if you feel that you have a brilliant idea, but you feel you can't implement it, give it to somebody else who can implement it. And that's the idea behind creating this forum. And today, when Vice Chancellor actually initiated this idea, one of the ideas in this was that among those 1,000 ideas that come out, if you feel that you can't, give it to the world, give it to the world as a gift. And today, that is what RGUHS is doing. It is live streaming the whole forum on YouTube and Facebook, so that whoever is able to nurture such ideas, let us open, collaborate, join together. And believe me, my friends, all you will get in this is more collaboration and more amount of support. So we've done a list of innovations. I'm just going to tell you that I have a few patents that we have done. We've done some devices, some theories that we have patented. So today, technologies that are going to define health 2.0 are going to be these interesting ones. And I want all of you youngsters to make a note of this: digital diagnostics, IoTs, ultra-fast scanners, wearables, blockchain, digital therapies, big data, nano health, AI, hackathons, system learnings, and robotics. I want to reiterate this to tell you that today healthcare will have to work hand in hand with technology. And that's why Indian Institute of Science, Triple IT, Bangalore Bioinnovation Center, and GHA and others have all come forward to join hands. And just imagine what we can do when we collaborate. This is another patent that we had received on something called drone bot, a combination of a drone with a robot, which we were potentially wanting to use for cancer screening. We piloted one of these. So I'm going to leave you with two important messages. One from Justice Justice of India. He's been my guru, mentor, and guide. He told me a very beautiful said that India should be looked beyond the limited milestones of GDP alone. Because to run GDP, you can actually give this country in the hands of smugglers. They will run it better and will run better GDPs. Our country should be looked at beyond that in terms of a philosophy, in terms of progress, in terms of expansion of freedom. And my friends, that is what we need to all think of. I want to tell you one thing he told us. He said, Vishal, if doctors walk from the home to the hospital, the GDP is low. If the 3 doctors again buy a nice car and drive it from the home to the hospital, the GDP is better. But if the same 3 doctors on the way to the hospital die, then the GDP is the best. So GDP does not mean that it is a whole and soul thing, and it is the benchmark of progress. So please remember this, that GDP is a limited milestone. What is really important is the philosophy behind it. And this again is something that you all should imbibe together. And this is my last point that I'm sharing with you. You know, this is a very interesting movie of Patch Adams, in which Patch Adams is admitted in a mental asylum. You all should watch this. His actual name is Hunter Adams, and he's actually seeing a scientist who is in this mental asylum, who keeps asking every patient who's entering there. He shows him 4 fingers and asks them this way, saying, how much is this? And when Hunter Adams, who has attempted a suicide, enters into the mental asylum, he again answers 4. So the scientist Arthur Mendelsohn looks at him and says, look, that's the wrong answer, and walks away. So, Hunter Adams is very worried, wants to find the right answer. So he goes back into his room that evening and asks him, Mendelsohn, Arthur, can you tell me what the right answer is? So Arthur is not interested in giving him the answer, but you know what he does? While he is actually sitting and talking to him and convincing him to give the answer, Arthur's cup is dripping. So Hunter Adams takes a small tape and patches it so that the leak stops. So Arthur looks at him and smiles and says, I'll henceforth call you Patch Adams. And then he tells him, I'll give you the solution. He says, again, he tells him, look at the number. And he says, you're looking at focusing on the problem too much. He says, go back. So he tells him to go behind. Now, as he goes behind, his fingers start to blur and he starts to see 8. So he tells Arthur, I think I'm seeing 8. He says, beautiful. He says, that's the way it should be. Because if you focus too much on the problem, you can't see the solution. So he tells him a very beautiful thing. He says, never focus too much on the problem. And that's another tip that I want to give you. Don't get obsessed with the problem. Go far away, go a little far away, give a bird's eye view to it, and you'll be able to see more solutions than what you have been seeing. He told a very beautiful thing, which I'm reiterating: see what no one else sees, see what everyone chooses not to see out of fear, conformity, or laziness, and see the whole world anew each day. My friends, today, the one single thing that I want to tell you is the question you're going to ask yourself is, can you rise above your excuses every day? And that's a very important thing that you all have to learn. Again, the last few points that I want to say is, if you think something is impossible, do not disturb the person trying to achieve it. Believe in them. They'll be able to do something very interesting. And never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And I'm having 59 such groups today. So I wanted to leave you all with these last thoughts that I'm confident you all are going to come up with something very interesting and interesting. And we are all here together to be with you. Thank you very much, Anita, and I'll close at this. Anita, if there are any questions or any doubts, I'll be happy to answer them. Otherwise, we can move to the next session.
Yes, thank you, Doctor. Unfortunately, I was unable to unmute myself. That was a lovely presentation, very inspiring, and I'm sure will encourage a lot of our youngsters to take the paths that you have been envisaging. Doctor, I have a few questions for you. Now that you have been an innovator yourself, could you give us a bit of timelines that you have probably, or milestones that you would have marked in your diary when you have crossed during that process of innovation?
So I think, Anita, the 3 points that I think what every innovator should note is, number one is, when you get an idea, you need to move from an idea to proof of concept very quickly, and from a proof of concept to a minimal viable product. Now, these are the most important steps where people get held up and stuck, and it is very, very crucial that these milestones are achieved quickly. I'm saying today, one interesting thing that we found in COVID, the learning was, I was discussing this with Ujjwal. I think Ujjwal is here today from Elsevier's. We were discussing that the time frame from bench to bedside, which means from a laboratory to a clinical practice, is to take on an average 17 years. From a lab to clinical research, from a clinical research to guidelines, from guidelines to bedside practice, would on an average take 17 years. In the COVID times, it has contracted to 17 days. And I'm telling you, I'm working on some diagnostic devices. I've been working on cytokine therapies, which we have innovated from our immunology lab. And we saw that regulatory, animal experiments, innovations, research coming together in almost 17 days. Now, this is the most inspiring thing that we saw, that it can be done. So the world post-COVID will be a new world wherein innovations are going to get fast-tracked. And this is the time youth will have to give more amount of their time and innovations to actually spend time on these.
One more question I have for you, as we have many students of RGUHS as part of our participants. As medicine by itself takes away a lot of time in it for preparing for their curriculum, if there is an idea and if they would like to innovate, do you think they can make time, and how do you think they should probably schedule themselves?
So I've been talking to universities across the world, whether it's Harvard, whether it's MIT, or whether it is other like Hopkins and others. What we've all unanimously moved towards is one single thinking, that we know that today youngsters have more potential than seniors. they have more energy, they have more, and they are able to create time. I don't know, for some reason, they are able to create time. So now, what if we can actually give them the confidence to say, yes, you can do it? Maybe the future will be looking at these students being entrepreneurs while they are students, also funding their own education eventually. And I think these models are already happening in the West, and these models will come up here also. And the sooner they come up, the better it is, that we show the medical, the fraternity, that this can be done. And these youngsters otherwise will get burnt out by the time of 15 years of education, and by that time maybe they have only skepticism left to actually say that they want to do this. So I would encourage more students to say, this is the time that you enter, this is the time that you are able to actually innovate further and join hands and move faster.
Thank you, Doctor. Thank you so much. And that is from my side. And we thank you again for that inspiring talk. And we continue to talk to you as we move on. Moving forward, we would like our partner, Microsoft, to probably give us an insight as to how Microsoft as an organization has been supporting innovators. I invite Gangadhar to come over and give his presentation on Microsoft and its support.
Let me know when you can see my screen.
We can at the moment.
Wonderful. So I think, thank you very much for having us here on this wonderful occasion. First of all, a warm welcome to all the participants. I think this is a very unique forum, and it's great to be here. As you know, today I've been among the best brains in the medtech fraternity. Thank you, VC sir, and special thanks to Dr. Vishal. I think I went back 20 years back in my career. I was like a college student listening to you. I was making notes. And you really, I think it was, you really brought in a lot of energy back, and how I can imagine how the students must be feeling at this point in time. Yeah, so I'll quickly move on. I don't have, just have 5 minutes. I'll just quickly take you through a couple of programs what Microsoft runs to promote innovation among students, startups, and what kind of resources are available for you, which you can make use during this hackathon. First of it, Microsoft runs this program called Imagine Cup, where we encourage students to come up with ideas and innovate and come back and participate in a challenge. The top winners will get mentorship and a lot of other benefits and support for them to work on that idea. There will be dedicated mentors will be assigned who will handhold you to think through the idea which you're working on. You can look at becoming a Microsoft student ambassador, which means, you will be the spear holder for being the bridge between the tech and the med fraternity. You can nominate yourself for it. There will be, some amount of commitment in terms of time you need to spend, and to get eligible to get selected as a student ambassador. Once you become a student ambassador, you'll have whole lot of resources available to you to learn and grow, and also help your other colleagues, other classmates, to learn to walk the tech path. Today, as you all appreciate, today health is not just health. It's a med tech. Everything what you do today has a tech layer in it, and tech and health cannot be really separated. As Dr. Vishal was talking about the 12 points, I work on those 12 things on a daily basis. At Microsoft, we do a lot of work on augmented reality with our HoloLens. We do a lot of image AI for predictive health, predicting various diseases, and we do a lot of work on genomics. So everything what we do is a tech plus health. So I think you get a flavor to learn all these technologies. When you go to Microsoft for startups and learn, you can see the lot of these technologies coming to action. You can go and create You can go and create your own account, go and download, go and create an Azure account, go and play with some tech. There is a lot of learning content available at Microsoft for Startup portal. We will be sharing those links with you separately with the participants going forward. If your project involves a tech plus a health idea, I think a lot of these tools will come very, very handy to you. So this is the Imagine Club Cup I was talking about. Last year, we had 2 million plus student competitors participating, plus from 100 plus countries. And this is for the last 2 decades, we are running this program. And the second one I was mentioning to you is about Student Ambassador Program. And this is Microsoft for Startup Learn program. It's called startups.microsoft.com. We will share the links with you. You can go and see how you can create an account and go and start using these tools, because a lot of these tools will help you in collaborating with the teams when you work as a team during these 3 weeks. And I strongly believe this is not just a journey of this 3 weeks. This is the first step in the journey, a long journey, which is starting with 3 weeks. And as a team, you will have to come together, put your ideas, thrash it out, fight in the team that this is idea we should pursue, this we should not, and finally arrive at that one big problem, not looking just at the problem, but looking at the complete ecosystem and figure out that this is a problem which can manifest itself into a very larger goal. And for doing all that, you definitely need tech collaboration tools, which will be made available to you on these programs. We also partner in the journey of startups in many ways. Microsoft runs various programs starting from Imagine Cup, which can help you to take the idea, build an MVP and present and win a competition, and later on come together, try to build a startup and ideate and improvise, and then go and become a Microsoft, enroll for Microsoft for Startup program. From there, the journey begins, and there are various forms and factors where Microsoft can support you in terms of putting the engineering thought together, assigning a mentor, internal, external. And we have something called reactor spaces in our offices where free-flowing ideation between tech and domain experts can happen. There is a scale-up program. Scale-up program is for those startups which already have a product and they're selling it. How do we help you to become from that $1 million to how do you become $100 million idea? From there, we have something called Microsoft's our own venture arm called Microsoft Ventures, which also gets you Series A. So you will hear a lot of these things as you get into this entrepreneurial journey. We do Series ABC investments as well in a lot of companies. In India also, we have a lot of companies where we have done that. And one interesting thing is today we are talking about an hackathon for COVID solution. So there is also a program we are running right now called Microsoft Global Social Entrepreneurship Program. Especially, we are now calling social entrepreneurs around the world with COVID solution. I'm sure a lot of you are thinking on the same lines. Please do visit our Microsoft Startup website and enroll yourself for this COVID challenge, because post this hackathon, a lot of you will continue to work on these ideas and want to make it concrete and bigger and make it impactful. These kind of forums will help you to give a platform to you to express your thought and build upon those ideas with the help of others. And one last bit is that as part of this partnership on this hackathon, we are providing Microsoft Teams, which is a collaboration platform where you can share files, chat, talk to each other on a video, audio call. You can create a group. You can have that same chat group available on the phone or a laptop, whatever you're doing. Work on common documents and a lot of things you can do to collaborate and break that physical divide which you have today. I think each one of the teams will get an access to each one of your virtual teams will have an access to Microsoft Teams solution. Make use of it. Our team can support you if you get stuck somewhere on a tech, if you have an idea, if you want to build an app, you don't know where to start. We could probably help you eventually. If you have maybe like-minded people coming together, we could also put some resource and help you to build like app in a day workshop kind of a thing. We could plan and help you. And please make use of the resource available. I'm very, very excited to see after 3 weeks what kind of ideas will come and what kind of products I get to see. I have been a jury for a lot of hackathons in IT companies, but this is the first time I'm seeing the health fraternity doing it. I'm really super excited being a healthcare guy, in Microsoft. I just manage healthcare. I'm super excited to see what comes out of this hackathon. Thank you so much. Thanks for this opportunity. And great to be here among you all. Thank you.
Thank you, Gangadhar. That was very nice. And it is good to have Microsoft supporting us, because we all today depend on technology much more than what it was ever before. So thank you so much. And thank you for partnering with us for this program. We move on to the next speaker. Our future growth relies on competitiveness and innovation, skills and productivity. And these in turn rely on the education of our people. This is what is very important, and we are focusing on education. I move on to invite our next speaker, Professor Sandhya S. Vishwesvaraya. She is going to speak on looking ahead, a confluences of science, medicine, and engineering. She is professor at the Indian Institute of Science. She was instrumental in establishing a new CREATE for biosystem science and engineering, where the vision was to bring engineers and biologists together to further knowledge and research. She worked in AstraZeneca for 5 years before moving back to academia. She is currently a Margadarshi Fellow, supported by the DBT Wellcome Trust India Alliance, where she is fostering closer interactions between clinicians in CMC Vellore and researchers in Indian Institute of Science. This has led to a creation of special MD PhD programs in Indian Institute of Science. She is a strong advocate of women's representation in the sciences and engineering, and promotes equity and inclusion in all activities in Indian Institute of Science and wherever possible elsewhere. Professor Sandhya, over to you.
Thank you very much. I hope I'm audible.
Yes, Professor.
Yes, thank you. First of all, let me thank the organizers for giving me this opportunity to speak on this occasion. This is really quite an innovative exercise. The first time that I've participated in any of these long distance talks. So let's see how it goes. The slides are being shown by the organizers, so I'm going to have to say next slide whenever I need to change my slide. Now, when I was asked to speak, I thought that I would share with you the problem of COVID-19 and the way the world actually is approaching this. And what I could see was that what we need in the years ahead is to bring in a confluence of science, medicine, and engineering in being able to talk about some of these issues. And this picture that I picked up on the web yesterday gives you an idea of at least the confluence of two rivers and how that goes on to really lead into a very beautiful downstream activity. Now, could I have the next slide, please? Could I have the next slide, please? Thank you. A little bit of an introduction on the Indian Institute of Science. This is an institution of more than 100 years old, and it's one of the leading academic institutes in India. And what makes it very unique is that under one umbrella, we conduct research in almost all areas of science and engineering disciplines. We have upward of 4,000 students, which include undergraduates as well as postgraduates. And there are more than 450 faculty who span, as I said, all areas of engineering and science. I could have the next slide, please. When you think about the challenges that are facing humanity, next slide. Sorry. When you think about the challenges that are facing humanity, there are many that have been at the forefront over the last few years. For example, global warming, decrease in biodiversity, racial inequalities, and indeed economic inequalities that we've seen in our country for many, many years. Of course, overpopulation, which brings in over-demand to the environment, and of course, disease. Now, the question is that in the face of all these challenges, why is it that COVID-19 became something that grabbed the world's attention at this point of time? Could I have the next slide, please? This pandemic has captured the attention of the world like no other incident. And what is the reason for this? Why have human beings been so obsessed with this small virus for something like 3 to 4 months? And I would posit that it is because this is one challenge that we as humans appear to have no control over. We were not able to initiate its entry, and it looks like we're pretty helpless in trying to be able to get rid of it at this point of time. So the next slide, the challenges that this particular virus, the challenges that this virus presented, of course, first began with the demand on the infrastructure of health services. And calculations were made, and there were deep concern that the number of potential patients would far outnumber the number of wards available, as well as the ICU, should any patients approach criticality. And therefore, this necessitated governments to really bring in lockdowns in order to be able to prepare the health sector to be able to receive this very large number of patients. The next challenge, next slide please, that was faced was that, do we really understand enough about the virus to propose treatment strategies? For example, do we really know how this virus interacts with cells? Do we understand how this virus actually affects cells? And these cells initially were thought to be solely localized in the lungs, but now we're beginning to appreciate that this virus has effects in other tissues as well around the body. One more challenge, of course, is the host component. As we look across the world, could I have the next slide, please? As we look across the world, we realize that the infectivity rate as well as the mortality rate seems to be largely different across many, many countries. And while we have high infectivity and high mortality in many countries in the West, there appears to be high infectivity but low mortality in countries such as India. This naturally brings researchers to think about whether there is a host component. In other words, does the genetics of the human also affect the response to the disease? And this may be really no surprise, since many diseases are controlled by the host genetics. And in the next slide, please. This is a respiratory illness. We're all aware of that. But we've now come to learn that it's likely to affect a number of other tissues as well. And if we're not dealing with only the respiratory illness part of this disease, do we have any idea how to handle effects, for example, in the kidney or in the heart? How does it affect these tissues? Again, too many questions for which we have no answers at present. Could I have the next slide, please? And finally, of course, we are aware that the severity of the disease is associated with a large number of comorbidities. And these are comorbidities which are largely non-communicable diseases such as diabetes, cancer, blood pressure. And we really do not know why COVID affects these patients much more than healthy individuals. And this is again an area of research which will happen in future. And so therefore, in the next slide, the only thing that I could say, and this again reiterates something that we heard Dr. Vishal say, is that there are many, many questions, and really we are receiving the answers as we're dealing with the problem right now. So the next slide, this whole disease, COVID-19, has brought in a flurry of research activities that have started all over the world. Next slide, please. These research activities include aspects related to diagnostics, therapy, understanding of the virus and the virus structure, understanding mechanisms by which the virus binds to the cells and elicits cellular responses, and of course, epidemiology. I needed the next slide for all this. Yeah. Now, of course, as far as epidemiology is concerned, we're going to get an appreciation of this only post facto and not at this current point of time. But all of these activities have led people to predict what would be useful, what would not be useful, and we're on the way to try to understand the disease better. And if I could have the next slide, please. One of the issues that we faced, of course, is the diversity in response and numbers across nations. So it almost appears that this disease has to be dealt with at a national level, even though we consider it a world pandemic. We've had very confusing messages coming out of WHO. So are governments responding to WHO recommendations, or are they making their own decisions? And for us who are able to understand what WHO is saying, as well as what a nation is saying, this can lead to some confusion in the way we deal with COVID. And of course, we also have the politicians who come up with their own theories, presented to the people, and this really does not help in terms of being able to take the thing forward. Next slide, please. So what is the way forward? And this again, I reiterate exactly what Dr. Vishal mentioned. It is collaboration. What we need to see now are collaborations across nations, across researchers, and across disciplines. This is going to involve multiple stakeholders, patients first and foremost, who can tell the caregivers about the kinds of experiences that they've had during their disease. We need to have industry chip in order to be able to build better ventilators, etc. We need open access to information. And again, I think this is a wonderful example of how sharing of ideas, presenting of ideas across a community is likely to lead to solutions. We can no longer allow ideas to ferment in the privilege in a few rich countries. We need to come in at this point of time and use our brains to understand what India needs in its own unique way. And very interestingly, perhaps we should learn from success stories such in countries like Taiwan, Cuba, South Korea, Vietnam. Now, it's very unusual that these are the countries where there has been success in controlling the spread of this disease. We should not be looking to the West. We should not be looking to the US or the UK in terms of how to handle this disease. Perhaps these countries provide the solutions that India is looking for. Now, if I could have the next slide, please. So where will collaborations help? Without doubt in the area of diagnostics. Talking to clinicians, what's the level of virus that we should be able to detect? Are there any correlations between viral titers and the severity of disease? Do we know that yet? Not sure. What amount of virus is required to be transmitted for infection? Should we be able to detect virus on surfaces, for example, in hospitals or in the materials that we touch on a day-to-day basis? And interestingly, are we likely to identify serum markers that can be detected more easily rather than actually looking for the virus in nasal swabs? Next slide, please. What about in the area of therapy? Collaborations will come in once we understand the disease sufficiently. Can we develop animal models that are easier to use for the testing of drugs and other therapies? We need systematic drug trials, but 6 months down the line, where are the patients going to be to test these drugs on? One certainly hopes that COVID-19 is out of the community by that time. Yes, we have a lot of excitement about the potential for vaccines, but do we know how the virus generates an antibody response? Do we know whether these vaccines are going to be able to neutralize the virus effectively? How do you conduct clinical trials to be able to test any of these things? And finally, of course, plasma therapy, something that I know many of our doctors are involved in. How do you determine which plasma has the right antibodies? Do we not need to investigate some of these therapies to be able to see whether they are likely to be efficacious at all? And again, if we're left with the problem of host response, how do you know that even though a plasma may contain very effective neutralizing antibodies, they will be effective in the patient that you're administering the plasma to? So next slide, please. So after the pandemic, we are faced with these kinds of questions. Will it reappear in a seasonal manner? Will the virus mutate? Viruses mutate, and we already have evidence from the available sequences of the virus right now that it is mutating at a very rapid rate. And importantly, we need to educate the public on the reality of this disease. I see that in many cases, a sense of panic has been created across the community. And people usually don't react well when they're in a state of panic. How do we calm the public? And not only the public, I must say, how do we calm the people who do not understand biology or the virus at a medical level? How do we reduce the panic in engineers, for example, who see this as something that's going to kill them tomorrow without being able to go forward? Could I have the next slide, please? So the way that I posit the way forward is to use interdisciplinary approaches. And to me, this is the way forward. We really need close collaborations between clinicians, researchers, and we need to listen to the clinicians so that researchers take on clinician-inspired research. We, as researchers, sometimes attack problems which fuel our curiosity, but are they really relevant to medical practice? And in the current scenario, I think we need to list them. In this way, we've made a small attempt in the Margdarshi Fellowship to explore clinician-driven research using the help of clinicians from CMC Vellore. So for example, at the onset of the COVID crisis, I received a mail from a clinician from Vellore who said that, look, can any engineer in IISc be able to create masks because we're not able to get enough masks to be able to deal with our patients? I suggested this idea to a couple of colleagues, and one of them, Professor Kaushik Chatterjee in the Department of Materials Engineering, has come up with an idea for which he's applied for a patent, where he's created a material which is able to block virus transmission through the mask. Now, these are all the small things that can be done at this point of time to help attack this particular disease, and we certainly hope that this moves beyond the patent that he has filed. We need engineers and clinicians to work together as well. For example, in the production of ventilators, telemedicine, using cell phone data for obtaining information across the country. We need artificial intelligence to be able to see whether there are any patterns that emerge which are not obviously seen by the clinician. And there are so many other examples where engineers can work with clinicians to promote their products. If I can get the next slide, please. There are a number of examples already with this interdisciplinary approach. I've listed a few here on this slide, and you can see that many of them are in practice and have all come out of interactions between researchers, for example, in the area of bone.
Dr. Sandhya, we would like you to repeat.
It was science that told people what bone cells required for their growth. The engineers that came in to produce these factors and implant them in pieces which could then be put in by the clinician into the bone that was required. We have microfluidic diagnostic devices which allow you to detect diseases within minutes. The antibody had to be studied by research.
Dr. Sandhya, we are unable to hear you. So I'm not sure whether all of you are able to hear. I'm not able to hear Dr.
No,
Sandhya.
Anita, we are not able to hear her, but I think there must be some connectivity issue. She may be reconnecting right now.
Okay.
I think we can ask Gautam to see if he can call her up.
Okay. Dr. Sandhya has lost connection and she's requested us to show the final slide.
Okay.
Doctor, can you please move to this final slides? So I would probably read out from the slide. She says, final comments on this ideathon. Most happy to see so many women participating in the diagnostics initiative. They always bear the burden of care, so they need solutions. Happy to see young participants. Their approaches are simple without the cloud and confusion of too much knowledge. Maybe a need to do this once the pandemic has subsided. Will we have learned lessons that can be applied should the situation arise again? And arise it will. This is after all nature at work. So this is Dr. Sandhya's final slide. I now would.
Yeah, I'll add 2-3 points to this. On Sandhya's behalf, I'll take the liberty.
Sure.
See, I think one of the things that she has always been emphasizing on these 3 important concluding points, I think today is also the era of gendered innovation. So what the young innovators need to think of is also keep in mind gendered innovations, because we know today that at many areas, women will need to innovate for women. So this is also the time that you need to think of gendered innovation. Globally, this is one of the thoughts that's going on. The second, like she rightly said, young innovators, young entrepreneurs, because they are not fogged by knowledge. That's a very nice statement she has made. They're not fogged by knowledge, because it's very crucial. Today people like Rolls-Royce today are having the non-domain experts. So they actually believe in something called the non-domain experts. I remember interacting with the Rolls-Royce CEO and he telling me that in the 20th century, knowledge was power, and in the 21st century, ignorance is power, because many of the times your education and your knowledge seems to restrict you and not help you think freely. So it's a very beautiful point that she's brought about. I think the first point was on gendered innovation. The second point she wanted to possibly convey was on the aspect of non-domain and being thinking more freely. So,
I'm here, Vishal. You're doing a better job than I would have done.
oh, thank you, Sandhya.
I got the connection back again.
Thank you. Please continue.
No. I apologize really, because after this rain, our Wi-Fi has been down and no one has come to repair it. So I'm operating through my phone. That's where the difficulty was.
Okay.
And please go on, Vishal. I think I've
No.
concluded, and I think I've said what I had to say. I do apologize for the poor presentation because of my connectivity.
Can we just request you to go back to the previous slide, Gautam? Maybe Sandhya can explain that. I think that was a very nice slide.
Sure. Yeah. So what I was trying to show here are examples of this interdisciplinary approach that has been put into practice and benefited clinical approaches. So for example, culturing skin for grafting in case of burn injuries, etc. This was initiated by people or researchers actually understanding how the skin is formed, what are the different layers of the skin, how do growth factors affect skin growth. This was then applied by end factors, and then this could now be applied, few skin cells could be into at a greater level. So what I've tried to show here are examples where some of this interdisciplinary approach, where you really needed 3 sets of people, the researcher, the basic researcher, the engineer to come and be able to put this into practice, as well as the clinician who of course understood the problem and knew what he or she needed to do to be able to help the patient. This was what I wanted to say on this particular slide. And the next slide, I think, is something that we've already discussed with Vishal there. I did want to emphasize, and I'm so glad he brought it up, about gendered needs, because most of the stuff that we have in this world is geared towards the male in terms of even car seats, for example, and seat belts. I find them terribly uncomfortable when I have to put them on. As I said, we hopefully have an audience of very young people who should realize that no idea that they have is too silly to pursue. And they should never hesitate to ask questions and come up with their thoughts, because there could be a gem of innovation in what they're thinking. And as I said, I think this issue of COVID is just testing humankind right now in how it's going to deal with such crisis in future. there are going to be more crises. After all, we're at the mercy of nature, and viruses are going to evolve. And I think at one point of time, they're going to say, we've had enough of humans, let's get rid of them and start all over again. And so we're going to have to be able to deal with this, both at the physical level, but also at the mental level. We need to be able to understand that we're going to have to bear the brunt of this for many years to come. And we should try to achieve a level of calmness in our minds and approach when we deal with these crises. Now, the final slide that I wanted to show was actually something where, we have this Triveni Sangam, where we believe the three rivers come together, the Ganga, the Yamuna, and what's called the mythical Saraswati. Now, I certainly hope that this confluence of clinicians, scientists, and engineers does not remain mythical, but actually becomes reality. And we do indeed see Saraswati coming out of all this. Thank you so much.
Thank you, Dr. Sandhya. For paucity of time, we would not take many questions at the moment. Thank you so much, and it was really wonderful. Hope we take cue from you and continue to collaborate and move forward, as mentioned by you in your presentation. Thank you so much.
It would be a pleasure. Thank you for your patience. Thank you.
As we move on, as I was talking about education, we need to know about IIITB, that is, which is in Bangalore, IIIT Bangalore. I had the opportunity to work with Professor Sadagopan years back in 2011 when we hosted the World Wide Web Conference. And I seriously feel, there's so much good to talk about him. He's such a guiding force. And I hereby invite Mr. Srikanth to continue to talk about IIITB for us, which is also going to lead our innovations that come out of this project.
Morning. Thank you, Anita, and thanks for the nice introduction. Can you please share my slides presentation, please? I will do a short presentation, try to keep it very quick and focused on what IIIT is, and since it will be new to some of the participants here. Next slide, please. Yeah. So we, as Anita just mentioned, we are a college, a university here in Bangalore, in Electronic City. We're just over 20 years old. And basically it was started to see how, with the IT evolving and starting up, how research institution, education institution could contribute to the growth of IT. We are research focused. We have a world-class faculty here. We have 3 key research centers and multiple labs covering the various domains of information technology and, interestingly, also social sciences. And we do a lot of work also at the intersection of IT and social sciences. We have a range of academic programs, all at the master's level and above, and we'll explain that more in a minute. We have about 1,000 students in campus, in residence, plus we have a variety of continuing professional education of campus courses. And we also run an innovation and incubation center on campus. Next slide, please. Briefly, we have 4 streams of programs. We have what we call the integrated MTech, which is, you get in there right after your 12th standard. JEE, it's integrated BTech and MTech in computer science and electronics and communication. We also have a master's program, which has been running for over 20 years now, which is a 2-year program in MTech in computer science and ECE, as well as a unique program called MSc in Digital Society, which is aimed at students who could be, in fact, from pretty much any discipline, who are trying to understand how technology and society are going to interface and the issues that come up looking at it from both sides. We have the traditional research programs. We have a robust PhD program and a Master of Science by Research program. And over the last few, though we've been doing it for a while with a lot of focus recently, a continuing professional education program where we do online courses, both PG diploma and certificate programs. Next slide, please. Broadly, the areas we work in from a research standpoint cover the range of computer science and related technologies, computer science, data science, VLSI, and what we call the information technology and society, which is the group that looks at both IT and society together. And they're actually staffed by faculty from social sciences, economics, political sciences, development sciences, and so on. Mathematical basic sciences, networks, communication, and software engineering. We have 3 large centers, which kind of are interdisciplinary centers where many of our faculty co-work on interesting problems. One, the Center for IT and Public Policy. Another one, which is Machine Intelligence and Robotics Center, and the eHealth Research Center. Next slide, please. What I'll do is quickly introduce the faculty from our institute who are helping in the hackathon as mentors, so you get some idea of what they can do and where they can help. Professor Amit Prakash, he works in again as a Center for Information Technology and Public Policy, and he's very interested in how IT and information systems and public policy intersect, particularly in the development sectors, and he's done a lot of work in public health, nutrition, skill development, and so on. And specifically looking at how information technologies can help improve work content for frontline workers, ASHA workers, Anganwadi workers, health workers, and so on. And he would be interested in mentoring the areas of telemedicine and community. Next, please. Professor R. Chandrasekhar, who's a Dean of Academics. He works in a variety of areas, but of relevance here is the technology for education and data management. And he could help in mentoring in areas that basically help evaluate how technology can make a difference in education, particularly schools education in the current situation, and in general in terms of technology for managing large data, documents, and content management. Next, please. So Janaki Srinivasan is part of a social science group. She looks at how social groups belong to, how the group that you belongs to affects how you look at digital technologies, how you access them, and so on. And she would particularly be interested in mentoring in the context of the hackathon, how vulnerable user groups would be able to experience or get excluded, or how would they have access to the kinds of solutions being proposed, and looking, among other things, look at privacy also. Next, please. Professor Ram Subramaniam is an expert on automatic signal processing, speech recognition, signal processing, machine learning, deep learning, and a whole bunch of related technologies. So he will be interested in mentoring topics related to signal processing, machine learning, and deep learning in this hackathon. And lastly, next, I'm Srikanth. I work in the areas of e-health, management of health data, and look at how mobile and internet can help healthcare solutions, and also on a side tangent, virtual and augmented reality. And I'd be happy to help with anything to do with the collection and management of healthcare data, processing, storing, privacy protection, and so on. And especially in the context of electronic health records and health applications. Next, please. And I'll wind up by just talking about our innovation center. We have a thriving innovation center, which has been there for about 12, 13 years, where a number of companies have been incubated. We focus on nurturing social innovators and aspiring entrepreneurs, and with a little bit of emphasis on social, relevant, and impactful solutions that would be interesting. Next slide, please. And what the center, which we call IMAX, helped, it's located at IIIT. It provides a ready infrastructure for startups to come in and plug in, get started. They can all be part of the research community that we have, both in terms of faculty, students, other innovators who are there, and external members. We allow flexibility in the membership and allow them to be part of various events and amenities that are there. And we have been able to nurture a lot of collaboration between these startups and others in the ecosystem. Thank you. I think that's a quick intro. And next slide, please. You can visit our website, IIITB.ac.in for the institute and IIIT.org for the innovation center. Thank you, Anita.
Thank you, Professor. Truly, I would say I'm very proud I'm here, representing many of such universities, be it Indian Institute of Science, IIIT, IIM, Bangalore, and all that. And I'm honestly very proud. And I hope we get to be inspired, continuously inspired by organizations such as yours. Thank you, Professor.
Thank you very much, Anita.
As we move forward, I would like to request all our participants to know that we have furthermore very good speakers in coming in next. So I would request you all to stay on and listen to them if you choose to take the path of an innovator. So there's one more saying that says there is no innovation and creativity without failure. As you have heard all our speakers till now who always said, do not be scared of failure. As we move forward, now we bring you an inspiring talk by Dr. Shyam Vasudeva Rao. The topic that he is going to talk about is very, very relevant: technologies to make healthcare affordable and accessible. Dr. Shyam Vasudeva Rao is an electronics and communications engineer from SJCE Mysore. He is a postgraduate in industrial electronics and PhD from Indian Institute of Science again. inventor of the first hardware-based antivirus card for PC, NoxCard, led to a company called Noxware in 1989, started the Offshore Development Center for Harris Communication and C.G. Smith Software, Bangalore, headed Ericsson R&D in India in 1994, worked at Philips Innovation Center as Innovation Manager, started Forest Health, MIMO Wireless in 2010. He is the technical director of Maastricht University Medical Center to bring doctors and engineers together to develop medical technology in India. So over to you, Dr. Shyam Vasudeva Rao.
Thank you. Thank you, Dr. Anita. Thanks to the Vice Chancellor and my good friends, Vishal and Rajesh and I. This is a great opportunity to interact with this crowd. I normally keep talking to the engineering folks, but this is the first time I'm talking to the medical fraternity and the students. I wanted to talk about quickly what are the technologies which we have on hand. Already we saw Microsoft and all that having a lot of things. And here it is more of my own experience and what I have been in a position to do with this. And that is what I thought I'll quickly share with you. If you go to the next slide, please. Yeah, let us take a case of non-communicable diseases. Of course, we are all now, seeing the communicable disease, what rampant things it can do. But there is the non-communicable diseases are something, which are the silent killers. And that is the biggest burden in today's world. So if you see, just take the case of diabetes and hypertension, we have around 65 million people who are diabetic in India and around 234 million who are hypertensive. And these are the mother of all the problems, okay, all care problems. So while going through this, I saw that a lot of people, who are diabetic, who are losing their vision. And then there are people who are losing their kidneys because of hypertension or diabetes. And hello, yeah, I lost my slides. And what we see is that we are actually, as a community, we are spending more than $234 billion. I'm not in a position to see my slides. $234 billion just, in loss of productivity due to diabetes alone. And what we are spending is just 1% of it. Okay. Sorry. Hello. Is it working? I can hear you. Hello. Hello. Is it okay? Let me connect.
Dr. Bhargav? Hello, Dr. Bhargav?
Yeah, can you hear me now?
Yes, doctor.
Yeah.
I'm so sorry. I think there was some problem with the connection. Yes.
Okay. So can you put it in the presentation mode, please? Yeah. So what, just catch up on that last slide, that the previous one, where you say 80% of these problems could have been managed better if we could have detected them in an early stage. Like, we could have avoided people losing vision or losing their kidneys, these sort of things. So the other important thing what we also see is the non-communicable diseases are hypertension and diabetes get worse due to stress. And in today's world, we cannot live without stress. Okay, so that's something which compounds the problem. So if you take the problem of eye care, we have around 20,000 ophthalmologists to serve around 200 million people who need some or the other form of eye care. And hence we are only in a position to address 10% of it. So there is 90% of these people who need this treatment who are not in a position to get an access to this healthcare. So if you go to the next slide, we have seen that in 2010, while I was the innovation manager at Philips Healthcare or Philips Medical Systems, we were looking at various problems of healthcare and see that WHO came up with this report saying that there is how to manage the mismatch in a medical device, or how to manage the mismatch in healthcare system. And what it says is the crucial 4 A's. And these 4 A's are availability, accessibility, appropriateness, and affordability. I will touch upon these in the case studies, what I'm going to take next. So remember these 4 A's: availability, accessibility, appropriateness, and affordability. This is what, makes this 90% of those who need healthcare not get access to healthcare. So if we go to the next slide. Yeah, so you see today's paradigm, we have a healthcare system, all this tertiary care, which is available in the big part of the cities and all that. And people, there is still around 65 to 70% of India, who are in the rural, okay? And all these facilities are available only in the urban area. And in the hospital, again, if you see, there is two different compartments here. One is the high cost, low volume region, and the other is the high volume, low cost region, I would say. And what we see is 70 to 80% of the population who come to the hospital will only come to this part, that is the one in yellow. And then for a few, they may come for a consultation, which is just for around 5 or 10 minutes, or they may come for some sort of a OPD checkup, or they may come for some sort of rehabilitation or dialysis or some of these things which are repeated procedures. So this is the one which causes a lot of accessibility issues, because people have to travel all the way from more than hundreds of kilometers just for this small little interaction. So that is where we thought that, if you hit the next slide, we thought that, can we do something where shift the paradigm from instead of patient go to hospital, hospital go to the patient. Okay, so these things which are more 70% of the time when they go to the hospital, these things could still be managed much better maybe through ICT and telemedicine. So what we can do is, or what we have already seen is, there are camps, there are kiosks and all that, but then do we have the appropriate technology for them? Okay, this is going to get access, but what are the type of technology they have? And then the other part is the treatment and rehab. Particularly if you take, today you see already all these occupational therapies, physiotherapies and all that have moved to homes, I would say. And then is there more serious procedures like dialysis, which can be moved to home. So this is where, we see that we can actually increase the reach to the population. So if you go to the next slide, so this is a paradigm shift saying how instead of patient go to hospital, hospital go to the patient. So this is one of the methods what De Bono says, and he says that how do you reverse the process? Okay, so that's sort of thing. So if you take a typical healthcare system today in the information and communication technology, the entire thing is moving more towards a handheld, a mobile device, or using the mobile connectivity and some attachments to the mobile, which is actually making things much more accessible. And these devices, what they have is a very rich HMI and user experience design. This is where we see that the engineers, artists, and also the doctors have to work together, doctors or paramedics, and come up with a very, very intuitive, safe, and secured user interface. Then devices have to be tested for its functionality very, very thoroughly, because when you are having these devices in hospitals, obviously, there are very well-trained doctors and nurses and paramedics who can actually handle them. But when you're talking about putting this into the hands of less trained health workers or in the individuals themselves, then, it needs to be really tested thoroughly. Okay, so that is the thing. On top of this device, with the interface, whatever it is, you develop applications. These are the mobile apps or companion apps, as I would say today. And these companion apps are basically doing the mobile, they are obviously connected through the cloud. So cloud connectivity is a very important thing. And social media integration, there are a lot of applications which are coming out now, which actually talks to the community. So there may be a group on Facebook, which is having a similar sort of a problem. So they may want to interact among themselves or share their lessons. And then, we also have machine-to-machine communication for continuous monitoring. So you may want to monitor a COVID patient, remotely for his temperature, body temperature or something like that, and reach out to them in case you find that they have something, something is wrong. So there could be several applications, and in today's world, more than in a day, there are more than 1,200 application mobile apps which come out. Okay, so that is the next part. And then what is the best part is that these applications with the device will generate a lot of data, huge amount of data. That's what we call it as the big data. And now you can launch several services on top of this big data. That is data analytical services, machine intelligence, machine learning, all that what we talk of, can be put on this service. And today, most of these hospitals and the healthcare systems have adopted the PPP model, that is the public-private participation, in which, there are several partners who come together to deliver this service. And so that is done in the service layer. So we go to the next slide. So we see that these are proven technologies, cloud technologies, which are there in the other industry like automobile, manufacturing and all that. We can bring that paradigm as engineers, we can bring that paradigm to healthcare. And healthcare is not just, one time I go get a fix and come back, it is a continuum. So we need to reach out to the people at the right time and with the right technology, then, connect them to the medical services. And it is not like, just making a Skype connection. It is much, much more than that. We have to connect them meaningfully with their health data, their health records, the EMRs, and then there are a lot of these databases available, these SNOMED databases, which are going to give you a lot of information about previous cases and all that. So that will actually help in help the doctors in doing a computer-assisted diagnosis. And then the GIS information is another important aspect today, where we see that geo tagging and hyperlocal applications are developed, like the Swiggies and of the world, for the healthcare also. And this is the connection. The connection is not just a Skype connection. That's what I wanted to tell you. Treatment, again, how do you reach out to people in the rural areas or in the semi-urban areas? Sustainability of this, because non-communicable diseases, as I was telling you, it is not like one-time fix. So you need to go back again after a procedure or after this one for follow-ups and all that. So all these, need the finances. We need to have these insurance schemes and all that to keep the sustainability. So this is the continuum, and to keep the continuum, what is needed is a centralized information and big data and the electronic medical records, which link all these together. So go to the next slide. Yeah, this is the platform which we developed in one of our companies called DHP. It's a Aadhaar-enabled EMR system which is on the cloud. Basically, this uses the Amazon cloud AWS architecture. It has interfaces to all these structured, unstructured data, as well as it has IoT interfaces to the medical devices. Okay, the handhelds and all that. And this information is put in a proper data structure. And on top of that, we have machine learning, which actually helps. It's a open architecture, a Hadoop system. And on that, you can actually program the various workflows linked to so many different ologies, and also to train the people on newer information, like you have the continuing medical education, e-learning module is also there on top of that. And then we have on the application layer, the cardiology applications. So anybody can throw an ECG to the cloud, and then this will give a report. So it's like that. And then, retinopathy, diabetic retina, we have a system where, the entire Andhra Pradesh, all the PHC have this machine which actually captures the retina image, put it in the cloud, and then immediately they get a report. Within 5 minutes, they get a report. And then similarly for chronic kidney disease and all that. So there are several applications which can be developed on top of it. So this is something. And then you have the workflows. So this is the architecture what we have we have developed. And if you go to the next slide. Yeah. So this is typically a OPD of eye hospital. So you have so many different modalities, and then you also have people going through each of these modality. And when they have to view the retina, image the retina, you need to dilate the pupil and then make the person wait for half an hour. And after the imaging is done, they have to wait for another 2-3 hours before they get back control on their pupillary action. So there are cases where, they are allergic to the drops, or they may not get back this pupillary action even after 3 hours, in which case, there is a need for medical intervention. So that's why normally this has to be, this is tagged, or it is attached to the hospital, and where there are doctors and who can actually take care of these eventualities. If I want to move this away from the hospital to a rural PHC, say, or to a camp, then the problem is this dilation. And then the number of equipment and all these, will consume a lot of power. All these were constraints. So what we have done is, if you the next slide, please. What is done is that we first took away the dilation process. By taking away the dilation process, you see that you can now, your dependency on the medical one becomes lesser, means the emergency handling becomes lesser. So this can be now moved to the rural area. And in a single device, we have put in all these imaging techniques so that, in one device, I can do anterior segment imaging, I can do refraction, I can do retinal imaging, as well as, look for cup disc ratio and all that through image processing and look at what is the intraocular pressure. All these can be now done in one device. And this device is made so simple and easy that it can be moved around. It has minimal amount of optics. And with that, we are in a position to actually do the entire test now within 5 minutes. So imagine 4 or 5 hours to just 5 minutes. And this can now be done at closer to their doorstep, I would say. So if you go to the next slide, having such an integrated equipment helps reach out to the people in a big way. And we have these devices in the field. We have technicians trained on this for 6 months, and then they can go do this procedure, they do this imaging. And then through tele-ophthalmology, they'll reach out to the doctors. So now in ophthalmology, again, this 20,000 ophthalmologists, 70% of them are anterior segment doctors, and then there is around 2,000 of them who are diabetic retina specialists or retina specialists. So what we see is if we screen a person, and then if it's a cataract case, there is no point in sending that person to a diabetic retina specialist or a glaucoma specialist, because glaucoma specialists are much more lesser. So there is a need for triaging. So that is what, an intelligent triaging happens on this device. And then based on if the case is a normal one, it just says, okay, no problem, you can carry on. But if it's abnormal or it finds some anomalies, then it is going to connect to the right type of doctor, specialist on the other side. Like it could be a glaucoma specialist connecting the glaucoma suspects and connecting diabetic retina to the diabetic retina one. So that way. So the doctor on the other side, can do the reporting from any form factor. They can do it through their computers or mobile phones or tablets or whatever, and from wherever they are. So that's the beauty of this, So you can now connect this people who are in the very, very sparsely populated rural area to a super specialist somewhere in PGI, Chandigarh maybe, or in Rajiv Gandhi University or something like that. So that way, this is how we can manage the mismatch here to get accessibility to the people. And at the same time, the cost is also very less, and indirect cost is almost zero. So that way, it is a big win-win to all of them. So if you go to the next slide.
Dr. Shyam, we need to progress a little faster. We are delayed by 35 minutes.
Yeah, so this is the way we, once you have a device like that, then you can deploy it in different modes also. It need not be only in the hospital, it can be in mobile clinics, it can be in medical camps or home screening, vision center. In the US, we do that in GP's office, okay? So GP's office can do ophthalmic checkup, okay? But that is, of course, usually with the back-end tele-ophthalmology, diagnostic labs and opticians. So with this, we are in a position to truly make in India really proud and made in India. We have today more than 4,000 installations in 25 countries, and we have reached more than 5 million people with this technology, which is fully grown, homegrown. Okay. So what I'll do is I'll quickly go to the last few slides. Can you go to the next? So the next, these are all examples, and this is the workflow example, then screening, and then we also made devices for diagnostic. Yeah, just 1 second here. Back, please. Just that slide, which is not just screening, it's also diagnostics, and also we are reaching out to the people for treatment at the doorstep. So that is the previous slide actually. It's called iRobo, which is the latest version of our eye care system. So in this, they can, through virtual reality, the doctor can remotely control the device imaging system there, and then they are in a position to do a detailed diagnostics. And also they have tools which we have provided, AI tools for various diagnostic things, and also comparing their own data, the longitudinal studies and all that, and also do a treatment planning and delivery remotely. And this is the part, where the laser, this one is integrated into the machine. So that's how we can reach out treatment at the doorstep. That's the next. So if you go to the next slides, I can skip these slides. Yeah. So a similar thing for nephrology, we do early detection with mobile apps, and then help them to manage the disease in the early stages, so that they can avoid the deadly process of dialysis or transplant as far as possible. Whereas, and then for those unlucky ones who end up at the end stage, we have a dialysis machine, which is a smart dialysis machine, first of its kind in the world, which actually can monitor the patient, and there are alarms and thresholds which can be set by the doctor remotely, and they can actually, the dialysis, the entire dialysis is actually done by a technician, which is what even today what we have. But here, the machine is intelligent enough to stop if there is any problem, and then the doctor can remotely advise the technician on how to manage it or reach emergency care. So this is a cloud-enabled smart dialysis machine. And further to that, we are adding technology by which we can reduce the amount of water needed. So we not only have remote monitoring, we also will be reducing the amount of water. So today, if dialysis takes around 140 liters of good RO water, with this, we can reduce it to less than 20 liters of RO water. So we can make it potable water. Okay. So that is the thing. This is again homegrown product, and it is gone through all the certifications regulatory as per the international standards. And now we are putting this device into the market. So next slide. Next. Yeah, these are the products: early detection, disease management apps, and the nephrology information system and the device. So if you go to the next slide. Yeah, the next slide. I think we have talked about it. So we'll go to, yeah, this is the one I thought I should share with you people. This is, we are all screening for COVID. But then, there is to some extent, we can go till certain extent. But now what's happening is that it is the vulnerable population, which is actually the one at high risk who need to be quarantined. That is the best way by which we can save, because this population, the herd immunity and all that, it gets very, very difficult. So in case we want to do that, there is a kit which we already have, which actually can check for these various things like the blood pressure, then glucose, pulse oximetry, and also, we can check the respiratory one and all that, and find out who are the people who are at high risk. So we can do a risk prediction scoring here, risk score for COVID, and then those who are at risk, they can be assisted by this other app which we have, which will actually help them to manage this one. And also, there's those who are quarantined, there is a quarantine tracking system, and also telecounseling, which can be done to help them stay at home, safe, and manage the COVID, the risk of getting infected. So we go to the next slide. All this is on the data platform, and the kit can be taken by these health workers door to door. And today they are doing NCD screening, but we can also add these additional screening procedures which are needed for the COVID, and make a risk assessment. So we'll go to the next slide. Yeah, the other thing is also for offices. We today, we'll see that there will be a lot of so those who are not wearing mask, or those who are not in those who have elevated temperature. So these people, we can actually autonomously screen them. That is, there's a front desk equipment, what you see there on the right side. So this will be in a position, this has both thermal imaging and white light imaging. So with that, with machine intelligence, we are in a position to do these various things. Autonomously screen them for these the temperature, and then non-contact, non-invasive method, and it's a foolproof system. It also looks for the mask and all that. Face detection, face recognition is also done. So, we don't have people now to use the biometric, because again, biometric, you are touching that every time and everybody is touching that. So here, it will, by face recognition itself, it is in a position to link up to the attendance system. And that way it gives a much more smarter way of managing these things, the offices, temples, wherever. So next slide, please. Yeah,
Doctor, may I please
Thank you. Sorry for the technical glitch.
Thank you so much, Dr. Sham. We are unable to take questions because of paucity of time. Thank you for the insights and what innovations have been happening with you. We move forward, and may I now request Mukta Sharma to give us a brief introduction on NSRCEL.
Thank you.
Thank you, Doctor. Mukta, are you there? Mukta? Mukta, are you there? Okay, we proceed to the next speaker. Mukta, we will get you back after some time. For good ideas and true innovation, you need human interaction, conflict, argument, and debate. So people, let's not be scared of conflicts and arguments when we have to truly innovate. Let's continue our human interaction. As much as technology and devices are taking over, we still need human interactions. I move on to my next speaker, Professor V. Ramasubramaniam. The topic that Professor V. Ramasubramaniam is going to speak about is ML and AI, artificial intelligence and machine learning, and medical applications. Professor V. Ramasubramaniam is in International Institute of Information Technology, IIIT Bangalore. He's completed his PhD from TIFR Bombay, that is Tata Institute of Fundamental Research. His research interests are speech recognition, speaker recognition, speech analytics, associative memory, machine learning, deep learning, zero-shot learning, one-shot learning, few-shot learnings, semi-supervised learning, or zero-speech multimodal learning. So if you ask me, it's all about learning. He has been engaged in research in speech processing and related areas for 3 decades. Professor Ramasubramaniam, over to you.
Thank you very much, Mrs. Anita, and thank you for inviting me over. I thank the organizers. I have about 10 slides, so I'll be very short. I'll finish in about 15 minutes, I think. And can I see the slides in full screen view? Right, thank you. Can I go to the first slide, the title slide? Yeah. Good morning, everybody. I'll be talking about some very elementary basics of machine learning and artificial intelligence, particularly in the context of application to medical applications and medical diagnostic applications. So let's move to the second slide. I do know that you are a community of medical practitioners and students. So it does look like being a non-medical researcher myself, it looks like taking coal to Newcastle in bringing some applications on medicine to you. But I'll restrict myself to what I know best, which is the machine learning part and the AI part. So just to quickly get to the definitions on the left side, I just want to, in a way, dispel some misconceptions about what's the difference between AI, ML, and deep learning and neural networks. These are much bandied buzzwords now. All of you know something about everything. And some of the practitioners in the field probably use some of these machines already, as has been pointed by the previous speakers. Specifically looking at AI, we are looking at being able to equip machines with a certain level of intelligence, which is similar to the human intelligence in decision making. And we'll see some examples of AI as applied to medicine a little later. And machine learning is a subset of artificial intelligence in the sense that it is a vehicle or it is a mechanism, mathematical mechanism by which you approach AI. And deep learning is even a subset, even a smaller subset of machine learning where you are dealing with large data sets and very deep neural networks to be able to do the machine learning aspects. And artificial neural networks themselves are one mechanism, a kind of technique which is used to realize machine learning and deep learning and AI systems. So having set the tone and ground for what is ML and AI, I just want to say in the second slide, we have various domains in which ML and AI has come to play. Typically, all of you know about speech and images and video processing and text processing, vision translation. All of you are familiar with Apple Siri and Amazon Alexa, Google Voice Search kind of thing. They're all happening thanks to the ML and AI approaches becoming very fruitful. Now I'm going to talk mostly about the medical applications, and the big players are a lot of them: Google, Apple, Microsoft, Amazon, including IBM. I'm going to take a lot of examples from IBM's Watson system applied to oncology and medical research. And you'll see that there's a wide variety of deep learning techniques, such as deep neural networks, deep belief networks, restricted Boltzmann machines, recurrent neural networks, LSTMs, and convolutional neural networks. And there's a wide variety. There's a family of networks which are happening in the area, which all go towards creating solutions for any of these domains, whether it's speech, music, image, or medical. Going to the next slide. I just want to quickly talk about where is AI playing a role in medical parlance, just to set the ground. Typically, AI involves algorithms. Yes, definitely it's a computer science area, so therefore we have to deal with algorithms. And we are dealing with also heuristics and pattern matching and a lot of rule-based, what are called protection rules, and more recently deep learning and what is called cognitive computing. Again, a buzzword now. Essentially to create approximate solutions which are equivalent to human way of decision making without a direct human input. They are autonomous systems, and we want to make them as autonomous as possible, both in terms of the ability to learn and ability to arrive at decisions on their own from data. And what can we do with using AI is we can definitely solve very complex problems that would have been otherwise difficult or even impossible for humans to solve. An example is a chess playing machine which has been able to beat the best grandmaster. Not that it is as good as chess playing machines of grandmasters of any time, but since the IBM's Deep Blue came, it has been able to surpass human performance to some extent. So we are talking about a dimension of human performance where machines can even surpass such human performance beyond certain dimensions at least. Now, what exactly can AI do in medical applications is essentially they can look at very meaningful relation in raw data. The raw data could be diagnostic data, could be pathological clinical data, could be your blood test, or it could be your electronic health record, heterogeneous kind of records, it could be the radiology reports, and so on. And also in treating, coming up with oncology treatment scenarios and predicting outcomes of patients undergoing certain treatments. And AI has been applied to almost every field of medicine, and more specifically including drug development in terms of finding binding factors and patient monitoring, continuous patient monitoring, and personalized patient treatment, typically in the case of genomic kind of applications, what are called personalized medicine. So I just want to give a nutshell ABC of ML in the next slide. Don't get alarmed by the technicality of that. No, previously you have to go back to the previous slide. Yeah, on the right-hand side, I have a very short sketch of what is involved in the machine learning. Let's assume that you have an input set of images, like 3 classes of flowers, Setosa, Versicolor, and Virginica. And what you want to do is to, given a new flower, you want to classify it as one of the images. That's exactly what happens in a medical radiology application. You may have a CT scan or MRI scan or a biopsy sample from a tissue, and you want to be able to say it's benign or malignant, or it's a particular kind of cancer cell. And you want to classify it into 2 classes, benign or malignant, or you want to classify it into multiple classes. And this is exactly a classification problem we do routinely in machine learning. So how do you go about doing it is to, from the raw data, which could be image or a signal from ECG or EEG, you extract features by means of feature extraction and go to something called the feature space, where the data, input raw data, whether it's image or radiology image or EEG signal, is represented as points in a high dimensional space. Now what happens is these points cluster in such a way, each particular category, each class, particularly a benign and malignant class, may fall into one cluster. And the machine learning involves coming up with models. We'll see what the models are, like a support vector machine or a random forest, to be able to draw what are called decision surfaces, to be able to distinguish between the classes. once the decision surface are done, the machine is ready to say, okay, give me a red point. The red point, I want to classify it as versicolor and not as setos or virginica. This is equal to saying that I have a new radiology image from a patient. I want to say whether it is benign or a malignant, or I want to put it into one of the categories of the cancerous diseases. So this now is possible now thanks to the advancement of machine learning applied to medical imaging. So this is essentially the ABCs of ML. With this, what I will say is if you have this ability to set up a machine learning pipeline of this kind, you are ready to go. You can set up any kind of machine learning application for a wide variety of medical application, medical diagnostics, and medical learning problems. So we'll go to the next slide, please. So just to quickly tell you about where machine learning has come to really make a big impact is on diagnostic imaging and genetic diagnosis and electrodiagnosis. All of you know all these categories. I don't have to mention them. I mean, you're all medical practitioners. So the large pie goes to the diagnostic imaging in terms of radiology reports, generating automated radiology reports from X-rays and MRI scans and CT scans, and even biopsy tissue samples and so on. And of course, electrodiagnosis is a second category where much of the bulk of the ML and AI has been applied. It includes doing algorithms on ECG signals on the PQRS complex to find out whether a particular patient has a certain cardiology disorder, or on the EEG signal to analyze a multi-channel, large multi-channel, maybe 128 electrode, 512 electrode kind of channel data, and do heavy signal processing or image processing on these data to be able to come up with a diagnosis of certain kind, to be able to detect certain patterns on which you can put a label saying the patient has this and the other category and so on. Now, among the whole, on the right-hand side of the slide, you see that a whole variety of machine learning techniques. So these are all terminologies which most machine learning people would know, and I'm just introducing you to so that you know the what exists in the literature. Essentially, we start a supportive vector machine, takes the big part of the pie, which is applied in ML and AI. The second part of the pie is taken by neural networks, and what you see in the left-hand bottom is an example of a very deep neural network, which is essentially lots of neurons connected together in a particular architecture, which is able to do a mapping from the input space to the category space. So you're able to do a mapping from the raw data of the radiology data or EEG data or ECG data, and being able to put a label on it saying something is benign or malignant or what kind of category it is. So and there are other techniques like logistic regression, discriminant analysis, random forest, linear regression, and so on. There's a whole bunch of techniques under the hood of any machine learning enthusiast and techniques that you would implement. Going to the next slide. Next slide, please. Yeah. So if you look at how these techniques, these support vector machines and neural networks have come to dominate, whether it's a radiology imaging application or a genetic diagnosis or electrophysiological diagnosis, you see the support vector machines stands the highest among the whole lot of techniques which have been shown to be promising, followed by neural networks and followed by various other techniques like decision trees, random forest, discriminant analysis, and logistic regression, and so on. So these are all currently available techniques for you to implement any of the diagnostic kind of techniques in the machine learning applied to medical intelligence. Now I'm going to talk a little about evolution of AI in medicine. Long back in 1972, when I was doing my own research at that time, I was a graduate student, a lot was talked about the Stanford University's mycin. Mycin is named after the antibiotic group of things which you know better than me. And they named it as mycin to be able to create an AI prototype program used for treating blood infections. So it can take a whole variety of pathological reports, clinical reports, and come up with churn out a whole bunch of 500 to 600 production rules. Production rules are basically rules which fire on input data, and the rules themselves can fire more other rules. There's a huge connectivity of rules, pretty much like a human decision maker would go about making a decision. When all these rules churn together and fire together, you come up with a diagnosis outcome based on the input pathological raw data. But right now, today, we are in a different ball game altogether. We have almost every kind of AI technology coming to picture. Some of the things I told you about, the neural networks and support vector machines and heuristics and pattern matching. You have Watson, IBM Watson, which is the Jeopardy fame. Some of you would know the Jeopardy game in which IBM Watson won over human players. It was a very big sensation in AI domain. And now it's used in places like Memorial Sloan Kettering Cancer Center to support diagnosis and also to create management plans for oncology patients. It's currently in picture. It's a business model and people are using it within the hospital's everyday operation. It effectively, what it does is it takes millions of medical reports from various patients and infers what a single particular patient's record the clinical trial should be looking like, and what should be the support diagnosis and the management plan for the critical oncology patient. And it turns out Watson's research has sometimes out-diagnosed some of the human medical residents in certain situations, and which is very promising for a AI kind of technology. This is not to say that at some point we'll make autonomous AI systems which will replace human decision making. That's not going to happen. I'll visit this point a little later. We definitely need AI as a supporting systems to be able to help a physician to come with the decision rather than go fully autonomous. So these are critical areas of decision making where you would not expect the AI system to be completely autonomous. So having said these kind of introduction to AI in medicine, I'll just go to the last two slides of my talk. Please go to the next slide. Yeah, I'll just in the left side, I'll talk about a series of applications which IBM Watson, the Watson has been put to for oncology, for genomics, clinical trial matching, drug discovery, care manager, and imaging clinical review, and so on. These are all available as products and routinely deployed in many clinics and hospital settings. And I'll close the talk by saying that if I look at AI as applied to medicine, a glimpse of it, where all it's going to be used now and in future, we definitely see AI as an efficient diagnosis mechanism to reduce errors. And it turns out that for breast cancer, the algorithms and deep learning techniques have even come to be better than even 11 pathologists in one of the studies. And this is repeating in a recurring manner across studies where AI algorithms can outperform human radiologist report making. And therefore, we expect these systems to exceed in some dimensions. Pretty much like we haven't understood the dynamics of the bird flying, the aerodynamics of the bird flying, but we have built machines like aircraft which can fly faster, higher, carry a lot of weight. And so we are succeeding in engineering approximation of the human cognitive mechanism. So to that extent, in some dimensions, we may really supplement and complement a human skill in coming up with diagnostic measures which can reduce errors, human errors. And of course, developing new medicines with AI, finding better candidates for developmental drugs. All of you know this already better than me. We are talking about being able to find binding factors, coming up with molecular mapping, which can tell you what are the protein structures which can map to a target molecule or a target antigen kind of thing. They can be done in silico. So these are called in silico medicines. And we're also talking about mining and managing medical data with AI. Large set of data can be heterogeneous healthcare record data can be processed very beautifully with machine learning and AI algorithms. These are called big data analytics. And you can synthesize such scenarios like Watson does to come up with medical outcomes. And we also have what is called AI robot assisted surgery. Some of you are surgeons yourself. So maybe you use some of these robot assisted surgeries in your own way. But right now, the AI robot assisted surgery helps you to plan, execute, and carry out surgeries with precision and high throughputs. But I would say right now, I'll close the remark by asking the natural question, what if AI system makes a mistake? Yes, AI systems are going to be prone to make mistakes. They're not infallible. They will make mistakes to the extent they are as good as only the data on which it's trained on. So if you are going to not have excellent data or excellent models or excellent diagnostic procedures to program the system, these systems could fail. So you need a backup plan to say that AI-powered systems should act like supporting systems which supplement and complement a human decision-making process, and not necessarily looking at a scenario where we are going to just say very confidently and arrogantly, hey, I can do it with medical practitioners. That's never going to happen. This is essentially enabling kind of technology, but it's happening in a big way now. So with that, I'll close my remarks.
Thank you, Professor. Thank you so much. It was really nice to hear you, especially on the technology side. AI and the machine learning taking a lot of importance in today's world. Now I move on to Mukta to come and give us a little introduction to NSRCEL. Mukta? Mukta, there seems to be some issue. We are unable to hear you. Okay, I'm sorry. I think we'll have to move on as we are running behind schedule. Mukta, please check in your audio video and be back. We move to the next speaker. They say exploration is the engine that drives innovation. Innovation drives economic growth. I invite Prakash Sharma and Reshma Tonse to come and speak about behavioral science for innovation. Prakash is the co-founder of 1001 Stories and a fanatical advocate of using behavioral science and design thinking to analyze, understand, and influence human behavior for creation of better products, brands, and organizations. Prior to 1001 Stories, Prakash worked in management with culturally diverse teams in Portland, Mexico City, Sao Paulo, Pune, Mumbai, and Bangalore. Prakash holds a BTech from NIT Jaipur and an MBA from IIM Bangalore. We also have with us Reshma Tonse. Tonse is a co-founder again with 1001 Stories. Her work is driven by social norms, socio-psychology, and a keen interest in folklore, culture design, and behavioral sciences. Before founding 1001 Stories, Reshma worked with Ogilvy, Low Lintus, and Saatchi & Saatchi. Her work includes several successful and award-winning campaigns for Geo, Idea, HIT, Rexona, BBC India. Over to you, both of you, to talk about behavioral science for innovation.
Thank you so much, Anita, for the lovely introduction. Thank you all for being patient all this time. Thanks a lot to Vice Chancellor, Dr. Vishal, and all the participants. We understand you have been waiting here for almost 2.5 hours now. And there is a certain energy to, hosting or conducting things online. It takes a little more effort, a little more self-control for us to be able to listen to what's happening, and it takes a toll. So thank you very much. I am Prakash. With me is Reshma. We are from 1001 Stories. And we will be talking about behavioral sciences and how you can use behavioral science to inform, to guide the way you do ideation for your product, you design your product, you design your solutions, or you think about policy. And then we'll see how we can use this in the field of healthcare innovations. Yeah.
Yeah.
And
so let's start.
Can you take the next slide, please?
Yeah. So essentially, we're here today to we are talking about the next big thing, the next great idea. And the anatomy of a great idea, a great genius, is the fact that it's able to solve real life problems using rational solutions. There are everyday rational solutions. We are looking at problems and saying that let's turn these into an opportunity. And the last thing is that we look at a great idea, looks at the context of where in the world it lies today, and it cracks the need of the hour. That's essentially what we believe is the anatomy of a great idea. Now, the deal is that as much as this might be the case, great ideas have been coming, have the whole world has run on great ideas. The first great idea, I mean, before we were even Homo sapiens, the fact that we decided to carve stones into tools because we didn't have weapons. There's a startup idea right there, right? And essentially, we're going to have to come back, take one step back from the domain of healthcare and just look at ideas generally and talk about how do you decide if your idea is working? That's essentially where we're coming from. Some of the best places to start is to actually look at some of the greatest ideas of the past century, of this century. Go to the next slide. We're going back about 80 years or so, and here was the next big thing after the Great Depression, the humble but incredibly humongous cake mix, right? This is a very, very interesting idea. It's about during the context in which this idea generated was the fact that during the World War, lots of the men from Americas, they left to fight the war. They were across the continent. They were across the continent, and the women were left behind with the children. And essentially, what happened is that there was no one to man the cash counters. There was no one to man the factories, and the women got out of the house and they stepped into those booths. And suddenly there was empowerment. These were women who now control their own purse strings. These were women who had their own money. They had jobs. And then the men came back and they took over. They came back to their original roles in the household. But the women refused to take that step back, right? And essentially what happened is that she started fighting this battle between being the modern day empowered woman and being the traditional trophy wife, what with pearl necklaces and mittens to welcome her husband home with. And at this time, what they started noticing was that women were buying dinner instead of cooking it because they just didn't have the time. So they started buying roast chicken and stuff like that. And Betty Crocker, one of the genius innovators of the time, said, this is a fantastic opportunity to give the woman a place and a venue to feel like she was traditional, she was still the traditional trophy wife without actually spending the time to do it. Pre-mixed, pre-packaged food, cake mixes. All that she needed to do was add water. And in 5 minutes time, her preparation was done and the cake was in the oven. But next slide, please. Essentially what happened that the great idea launched and pre-mixed and cake mixes were launched and they bombed. It completely bombed. It did not go off the shelf. No one picked it up. And Betty Crocker was left scratching their heads. What happened? This was a phenomenal idea. There was a brilliant rationale behind this real life problem. This was a problem that had this phenomenal opportunity here. Why didn't it work? It was the need of the hour. What happened? And then they went back and did what they should have done before they started this, which is they spoke to the human being they were trying to get to buy into this behavior. We go to the next slide, please. When they went back, they redefined the problem and they realized that what the woman was feeling was, she felt like she was cheating her family. This was Betty Crocker's recipe, not her own. This was something that she did nothing for. She just added water. She did nothing. And she felt like she had no role in, actually preparing this cake. And because this is a phenomenal company, they went back, they thought about their idea and they said, let's bring in this human behavior, this insight that we have got from human behavior and see what we can do. And what they did is they recalled the product and redesigned it, where they removed one very important element of the product, which was eggs, and added one instruction. And they told the woman, add eggs. That's it. And Betty Crocker became the giant that it is today, simply because it actually did not try to make the life of their consumer easier. It made it slightly harder, triggering what we in behavior science called the IKEA effect.
Yeah. So essentially what this tells us is at the end of the day, it's a behavior which can either make or break the adoption and usage of your product. It can influence the effectiveness of your product. And if you go to the next slide now, we see similar examples in the field of medicine. This is a famous study done by N.K. Chaudhary in collaboration with Harvard and Aetna Insurance. I think it's a fairly recent study. And what they found, look at this, right? So heart control is, better cardiac healthcare services. It's been quite a concern for the last 70, 80 years. There have been a lot of advances in it. And so today we have the ability to perform complex surgeries and then put patients on post-care systems, right? What this research found was, when you look at the behavior of patients some 6 to 8 months after this life-threatening event, which they have gone through, they find only some 39% of the prescriptions are actually being filled or purchased. 39% of all the prescriptions that were suggested to them in general. And when they did a randomized control trial and they decided to reduce the co-payment charge just to see what happens. It did go up marginally by 6%. In this case, we had only 45% of prescriptions being filled, right? Now, this should actually be alarming because with all the advances that we have got, in healthcare, at the end of the day, your patient is consuming only half of his scheduled medication. Now, why does that happen, right? So in general, studies have found out that 1/3 of prescriptions given by doctors are almost never filled, never purchased. And when we actually end up buying, those medicines or those prescriptions, half of the patients do not take all the prescribed medication again. In fact, there have been studies around it, and it says somewhere around 1,25,000 deaths, at least in the US, could be avoided annually if only we could bring about adherence to the medication that's been prescribed by the doctor. Now, knowing this, what does it mean for us as innovators, as doctors, as product designers, and as policymakers? And on the next slide, please. Yeah. What we'll find is essentially, we have been designing products. And when we design products, we design solutions, we come from a very rational point of view. We look at human beings as rational decision makers, as people who understand what is good for them and are always going to take decisions which are in their interest. The reality, though, is the human is an irrational being. They have got certain predictable patterns of irrationality. It doesn't mean we are mad. It just means we act in certain ways which seem very counterintuitive, which is why you will have someone who has just gone on intensive surgery, smoking out, filling his lungs with smoke, or people who are actually trying to get into fitness, who have paid the money for it, going to a gym, but instead of taking only 12 flight of stairs, they would rather use an escalator, which again seems very counterintuitive. So the question is, how does this human mind work, right? Now, in an ideal situation, the human mind is supposed to be completely rational, almost like a computer, take in all the inputs, analyze them, and then take a good decision in self-interest. But in real life, what research has shown is decision-making is a function of limitations. These are limitations on the next slide, please, or the limitation on our cognitive abilities, which means either we have too less information or we have too much information. And it's a limitation in the amount of time that is available to us to make decisions as human beings. What this in turn means is we default back to biases and heuristic evolution has coded in us over the last couple of 100,000 years. And now comes the question. If in general, a human's decision is going to be guided by his biases and by his heuristic, we go back to the same question. What does it mean for us as innovators, as product designers, as people designing services, as people designing policies?
Next slide, please. Essentially, what this means for us is that your decision making is what is the decision-making process rather of our consumer or the person for whom we are innovating this product, that plays a huge part to play in the way that we design our products as well. Now, when we speak about decision-making, we're not talking...
You need to speak louder, please.
Sorry, is this more audible?
Yes, it's better.
You're saying that essentially when we're speaking about decision-making, we're not talking about the decision to purchase the product or the decision to fund the innovation. That's a mammoth topic, that's for another time. But essentially, this is about a small, involuntary, bordering on your subconscious. It's decisions that your user needs to take every single time that they encounter the problem that your product is looking to solve. Let me simplify it. Essentially, think about an idea where there's a fabulous mask. It doesn't even allow a singular micron of dust in, right? But it needs to be discarded every 12 hours. No doubt it's a phenomenal innovation. But essentially, what this product does is that it requires its user to decide every half a day whether I need to change my mask or not. What does it mean? It means that I run the risk of my product being rejected twice a day. this is going to come in the way of good innovation. This is going to come in a way, it's a great idea, but it's going to come in the way of its workability. Workability is essentially what we're talking about when it comes to decision making. It's not about the purchase of the product, it's about the ability to adopt to the product. There are three aspects to this decision making: context, the second is whether it challenges my status quo, and the third is taking the path of least resistance.
Let me tell you about a study which was done in 1995 by Riddle, Myers, and Shafir.
You can go to the next slide.
And it talks about this case where the research basically talks to doctors where you have a patient who is suffering from chronic hip pain in the hip area and is now on his way because you have recommended a hip replacement surgery for him, right? And as the patient is on his way to this operation theater, you as a doctor realize there was a particular course of medication, let's say ibuprofen, right, which you forgot to try, it didn't occur to you. What would you do now as a doctor? And when this question was posed to doctors, almost, if I remember correct, almost 80% of the doctors said, I would call the patient back from the path to the surgery, and I would start this treatment on ibuprofen for him.
The next slide.
Now, what happens is, the doctor made a good decision out here, thankfully out here, and things go good. But what happens if you give the doctor one more choice and you say, listen, it's quite possible you missed out two possible treatments.
Next slide.
If you go to the next slide, you'll see is ibuprofen and I think it's proxicam, right? What would happen in this case? And it's very interesting to note that just the addition of one more extra treatment method, which the doctor did not try, in this case, the numbers reverse. Almost 80% of the doctors would now let the patient continue with the hip replacement surgery. This is not a question of incompetence. This is not a question of malice. This is not a question of, a sinister-minded work. It just is a question of how does the human mind work. We human beings are creatures of habits. We are creatures of behavior. And once again, I'll go back to the point that we've been trying to make. It becomes very important for us as ideators, as innovators, as policymakers, as doctors and healthcare professionals to understand how is the human behavior coming into play with my ideas, my solution, my suggestion. On the next page, please see, if we just take decision making, right? Decision making, it plays heavily a lot around context, which means, among many other factors, which means how information was passed on to you, which means, am I saying your startup has 70% chances of success? Or do I tell you your startup has 30% chance of failure? How am I framing the context? Status quo. What is the default status provided to you? What is the default choice provided to you? And the path of least resistance, which basically, if you go back to the example of the person who are going up on the escalator to the gym as opposed to taking the stairs, because the escalator is available to us, path of least resistance, right? These three aspects heavily play together when it comes to making our decisions as human beings. Behavioral science is, to be honest, a huge topic. 15 minutes, 20 minutes would not be, it would be wrong for us to be able to claim to be able to give you a good idea of it. But we do want to leave a small toolkit to you all, to the students, to the innovators, everyone out here, which we believe we can use to make our product better. And this small toolkit, you can see, if you go to the next page, it comes from talking about or understanding three key aspects, right? You can call it the 3Bs model. In fact, it is called the 3Bs model, popularized by Diana Relly. You look at the behavior, the first B that you are trying to change. What is the behavior change that you're attempting for? The second B looks at barrier. What are the barriers that you can encounter from the system, from the person's point of view, from a choice architecture point of view, from a default option point of view, when it comes to adoption of this behavior? And last is, what are the benefits we are trying to provide by bringing about this behavior change, and what is the best way of packaging this benefit, contextualizing it in the best possible manner, framing it in the best possible manner, so that decision making or behavior change becomes easy for our intended target audience or consumer. It will help a lot if you can use this toolkit right in the beginning of your ideation phase as product designers, developers. You can also use this toolkit to evaluate your product. And we believe this toolkit can also help you guide public policy making, especially in the field of healthcare. And we would love to talk a little more, but we understand, that this should be good enough of a primer to make you all curious about the world of behavioral science. And we welcome all of you to explore this science. Thank you so much.
Thank you, both of you, and thank you for maintaining time, and really appreciate. So we move on to get a presentation from one of our partners, GHA. Ramchandra, over to you.
Can you put on the presentation, please? Good morning to all. Very glad to be here, privileged. Thanks to Honorable VC, RGUHS, Dr. Rao, and all other partners. We are to work with all Microsoft, IIT, IIM, and GHA has been formed with a very different vision. As all the speakers have shown, and the very idea of this hackathon is that we are dealing with healthcare challenges which are unprecedented. So the rate of obsolescence of various, right from drugs to devices in healthcare is changing by the day. Actually, the IT industry was known for high rate of obsolescence, but today the healthcare is taking over. And this calls for not only innovation and enterprises, but also, next slide please, also developing a competent workforce. As you know, healthcare is one industry which is still a human service industry. In spite of a large degree of automation, we still have humans serving humans. So we need competent but also compassionate people. A lot of the formal education that is happening in healthcare, whether it is at the nursing schools or medical colleges, are focused on technical skills, clinical skills. But like the previous presenter just said, there's also a strong behavioral aspect. So we also work on core competencies, soft skills, and we try to bridge the gap between formal education and the industry requirement. So right from our promoters to our academic council, it is highly industry driven. We provide a huge, education industry interface. So whether it's training of community health workers or freshers as allied healthcare workers, where there's a huge demand, and this pandemic has shown that right from emergency technicians in ambulances to medical lab technicians, we face a huge shortage of human resources in this country. Then the continuing education for doctors is also one of our forte. In the previous years, this was not a point of highlight in the medical profession. But like I said, with changing knowledge parameters, changing treatment protocols and new challenges, diseases emerging by the day, continuing education for doctors is very important. And we are playing a huge role in this by linking doctors with experts, specialists, and also with our global footprint with HCG hospitals, CIM Globals. We are trying to bring the state-of-the-art knowledge to doctors and practitioners in India. Next. Yeah, so this we are participating in this Ideathon through our innovation hub, where we are again trying to fill the gaps. So filling the gaps is one of our core themes. Filling the gap between the idea, taking the idea to a product, taking the product to market, and so on. Because we work in the entire healthcare ecosystem, we network with a lot of people. So we feel that we are poised to be this incubators and innovators. So we will be providing services at all stages, right from mentoring with all our specialists, doctors, technicians, to market linkages, financial linkages, regulatory compliances. So we have set up an innovation hub in the heart of Bangalore, and being in this city with all these medical hospitals, pharma, and scientific and research institutions, we feel that we can play a huge role in promoting these innovations and incubations. And we are very much happy to be part of this hackathon, Ideathon, and we look forward to mentoring these innovators. Thank you.
Thank you, Ram. We move on. We have Bindu Sharma as our next speaker. The only way you survive is you continuously transform into something else. It's this idea of continuous transformation that makes you an innovation company. Bindu has been helping organizations in their, in patenting them and things like that. Ms. Bindu Sharma is the founder of Origin IP Solutions. She is a postgraduate in microbiology, LLB from Bangalore University, and a registered patent agent at the Indian Patent Office. Origin IP Solutions has been recognized by Niti Aayog, Social Talk, Government of India for its excellent contribution in the field of patents. And Bindu Sharma has been recognized as excellent leadership in the field of patents. So over to you, Bindu.
Good afternoon, everyone. First of all, thanks for inviting me for this session. It's really showing my screen. Okay, you can just put slideshow. Okay, so patents and healthcare innovation is a topic which has got lots of attention during this time, COVID time, and there is a list of new patents that people are filing. There has been lots of innovation happening around, and also digging information on what is already available to be commercialized. So in due course of time, I'll take you through very quickly on how healthcare innovations are important, and secondly, what are the unique provisions we have in the law, and they relate only for healthcare innovations, and especially at this point of time where there is a critical situation in the country. Next. Okay, when we talk of innovation in healthcare, or for that matter any other technology, there are two things that come into picture. One is functionality of the product or design, or both. Now, if you look at this mask, so innovation could be in the design. So any material of the mask, but design is good, and there may be innovation in terms of functionality. The material mask is made of, the way it has been stitched, the way it covers the mouth. So starting looking at the history of masks, there has been lots of innovation with respect to the composition of material used to make mask, as well as design of the mask. And I must say, for the consumer, both are important. For doctors in OTP, doctors working in OT, probably the content or composition is important, but for the user like us, design is equally important. Next. Now, what is a patent? So patent is a kind of protection that is given in the law for your innovations. So for any new product or process, patent can be applied for. So when we say new product or new process, it could be product itself or process to make the product, and it has to be novel. So when you have new idea, you can probably run a quick search on Google Patents or any other free databases to see whether product is novel or not. So once you are assured of novelty of the product, maybe you can assess the second step of patentability, that is industrial application. So your invention should have capacity of being used or made in the industry. And third condition to get a patent is inventive step. So if you just combine two products and produce a new product, so then A is also known, B is also known, and you just combine A and B and bring in the market product C. So that does not become a product that can get a patent. So that is just a combination of existing devices. So your invention should take technology one step ahead, and it should have inventive step. So if your innovation or your invention is novel, it has industrial application, and it has inventive step, it has all the reasons to get a patent, and one can apply for a patent. We have 4 patent offices in India: Chennai, Delhi, Calcutta, and Mumbai, and you can apply in the suitable patent office. And once you file your application, you get your application number and date of filing, and that is a very good reference. and from that particular day, the protection part of it starts. So for any innovation, if you want to claim ownership over it, it is important that you file a patent for it. Next. Now, advantages of filing patent are many. I'll take you through that. But some pointers, patents are mainly filed to protect innovations. Date of filing is very important. If I have filed my patent today and you file the same patent tomorrow, so I get a patent because I have a priority of 1 day. So as soon as you conceive idea, you must, file at least provisional applications so that you do not lose anything on the date, because patents are granted on first come first serve basis. And advantage of filing a patent is that, once you get a patent, others would use your permission to use it. Without your permission, people cannot use it. So if they want to take your permission, they have to actually take license from you to use your invention. And the way the whole deal happens, I must say, the deal that happens from a patent holder to the company that is interested in manufacturing the product is called as technology transfer. And there is a important component in the technology transfer, which is called as royalty. So having this kind of arrangement, the inventors can really generate lots of revenue if the idea or product or innovation is good. It's important to understand that term of patent is 20 years from the date of filing. So you have patent protection for any kind of product only for 20 years, and this remains same for all areas of technology. So after expiry of 20 years, your patent is in public domain and people can use it without your permission. So 20 years is the time which is given for the patent protection. Another important thing to note is that patent rights are country specific. If you have Indian patent, it is valid only in India. If you have US patent, it is valid only in the US. So if you want multiple protection in multiple countries, then you have to file your patent application in each country, even though there are ways to file it conveniently in multiple countries. But again, end of the day, each patent office should grant you patent if you want to have protection in that specific country. Next, please. Now, these days, lots of patents, if you talk about healthcare, there are wide range of patents that you see. And in order to use those patents, you need permission of patent holder. Generally, you need permission of patent holder. Without that, you cannot do. But in this critical kind of scenario where the country is struggling with the pandemic like COVID, there are some relaxations in patent laws where there are ways that you can use some of the patents with permission of government. But yeah, any product you see around, there is definitely some kind of IP that is already registered with respect to those patents. Next. Yeah, Dr. Vishal must be watching this. So healthcare innovations, I don't think it is complete without referring to this, this product. Home device. So this is one classic example of innovation, and Dr. Vishal owns multiple patents, not only for functionality of the product, but also for the design. And one good thing which I like about his invention is that, he has used this wooden inserter. So I'm sure he would have option of having plastic inserter or any other material, but he opted for a wooden inserter. And for that also, he went to Chanpatna and got it done by a toy maker. And I would also like to share here is that, this technology of wooden toy making is geographical indication of Karnataka. So by doing this, by having this wooden toy as a inserter, he also promotes a geographical indication of Karnataka. And Karnataka anyways holds maximum number of geographical indications in its name. And that's something to feel proud of. Next. Okay, how does a patent help? So patent helps healthcare innovations in multiple ways. It protects innovation. If you are a startup, then you have a strong position in the market. The moment you label your product as a patent applied for, authenticity of the product goes up, and people start believing you probably, and it gives you recognition in the market. You can impress your investors by telling that we have a patent on it. Then marketing, branding, you can label your website, corporate presentation. So all together, patent helps in multiple ways, and there is no side effect of filing for a patent except that it costs you. Next. Now, as soon as you have new idea, it makes lots of sense to document the idea first, because whatever idea, as long as it's in your head, it just evaporates. So you have to put it in a particular shape, and you have to document your idea. So initially, you can assess novelty of your idea by doing the simple patent search. You can use free tools to start with, but later on, once you know that idea is good and you want to file for a patent, then I would not recommend you to go for free tools. You need to have good databases where you can search and find out how good the idea is. And after you're sure about novelty of the idea, you can file first in India. It is almost mandatory for you to file in India. And after that, you can go for foreign filing anytime within 12 months of time. After application is filed, product should come in the market. The official figure is that only 3% of the patents, they see the market. So, but today we need lots of products, innovative products, because we are moving towards self-dependent or Atmanirbhar India, and we want to promote local products. So in that case, it's very important for us to bring more and more products in the market. So there are three common ways you can bring your products in the market. One is to have your own company, your own startup. You can also explore joint ventures, and you can also license your technology to other companies that have capacity of manufacturing, marketing, and selling the product. So this way you can bring your product in the market in really a short time. And as number of patent filing increases, there is also lots of risk of infringement of IP. Every third day, you see lots of pharmaceutical companies fighting with each other on patent infringement cases. So this is one very critical element where, before product launch, you should get your patent infringement risk analysis done. Next, please. Okay, now I'll take you through some very unique provisions that we have in patent law, and they are very relevant for today's scenario. Suppose you own a very beautiful patent, you are earning lots of money because of that patent, innovation is good. But if there is an emergency situation like COVID, government can acquire any of your patents anytime. They can do it anytime. They can acquire your patent, and they will pay you a nominal royalty fees also. But government can acquire your patented invention anytime, just like they can acquire your land to make flyovers. They can acquire your patented invention also if it helps the public at large. Next. Now, there is something called as compulsory license. So suppose there is a drug now tomorrow, any drug comes for COVID, and companies, a pharma company owns that particular drug, but that drug is not available for public at affordable price, and public demand is not fulfilled. In that case, any other company can request controller of patents to permit them manufacture the drug so that so that requirements of public are met and patients are not suffering because of lack of the drugs. So this provision has been kept to have a very clean balance between public health and patent rights. So this provision has been used in India in few cases, and it works quite well, especially when you have a scenario like COVID. Next, please. Okay, then there is another thing that that is called as Bolar exception. So even if there is a patent and there is a drug that is patented already, and you are a generic drug manufacturer and you plan to manufacture that drug in your company, in that case, as long as patent is in force, as per law, you should not be using the patented invention in any way. But but there is some exception here that you can do reasonable experiments with that particular drug as long as patent is in force. And these reasonable trials should be only to get approvals like FDA approval. So this is again one exception where patented invention can be used for reasonable trials, even if patent is in force. Next, please. Okay, so I'll just conclude my presentation. So you all know that healthcare innovations, they have great contribution to human life. It always was a great contribution, but it is more now. So creating a culture of innovation, awareness on IPR for students and faculty, it can play a very important role to boost and generate new ideas. And it's not necessary that all new ideas, they have to be executed by you. You can always work on licensing a model. So you keep generating new ideas, keep protecting, and you can keep licensing, out licensing your patents. And we don't realize that sometimes solution of complex problem is very simple. For example, there are lots of examples around to support the fact that solution to complex problems is simple, and we must work on the solutions. So this will be important step for self-dependent India. And that's all from my side. And I feel I finished well in time.
Yes, thank you so much, Bindu. I really, really appreciate now that we're running so much out of time.
Yeah.
Thank you so much. And I'm sure there'll be a lot of questions from the participants, which we will forward to you, and you will be with us for the next few months. Thank you so much. Thank you so much. Now I would request Ankita from Bangalore Bio Innovation Center to come and kindly give a little presentation about BBC. Ankita, are you there?
Yes, I'm here. So can you put up our presentation, please?
Gautam, can you please put up the presentation? Okay, Ankita, there seems to be a problem. I will probably go on to our next speaker, who's again luckily from BBC. And after that, we will have your presentation. May I now request Dr. Jitendra Kumar to come and give his talk on bioinnovation perspective. Dr. Jitendra Kumar is the Director and Head of BBC. Dr. Kumar holds a PhD degree in biotechnology from Institute of Microbial Technology, Chandigarh, a prestigious national lab, and Jawaharlal Nehru University, New Delhi. He worked on various cutting-edge research projects related to chromatin remodeling and its role in, role of peroxides in inducing mitochondrial dysfunction in heart, liver, and brain. He's the author of on several internationally acclaimed peer-reviewed papers. He holds an MBA degree from Fisher College of Business in Ohio State University. Dr. Jitendra Kumar, over to you. Gautam, can you please load Dr. Jitendra Kumar's presentation?
Hello, everybody. Thanks, Anita, for your kind introduction. As I am heading the Bangalore Bioinnovation Center, I would like to just say a few words about the center itself, which Ankita will, my colleague will detail more. But because I want to put this in perspective, that's why I would like to know, tell about Bangalore Bioinnovation Center, and then what Karnataka government has created the ecosystem in which you can tap into, and how your innovation can become just from idea to a commercializable product that I would like to delve into. So can you go to my next slide? Yeah. So Karnataka's ecosystem is very well known. It is one of the best places to work, especially Bangalore. It has Bangalore has been ranked as number 11th in city for the startups, second fastest growing startup ecosystem. It is first state to announce the multi-sector startup policy, and there are huge number of startups. Bangalore is considered as a startup capital of the world, and the average valuation of the startups in the state is around 3.3 million US dollars. There are a lot of companies which you might have known. These can act as your inspirations. Anthem Biosciences, String, Biocon, of course, Pandora, Mindra, Syngene, and so many companies. I have listed only a few of them, but uh, we who are in this ecosystem know that there are very, very inspiring biotech companies in operating out of Bangalore. And therefore, I would like to just delve more into what kind of facilities and what kind of encouragements are there from the government side, and in how you can tap into this. So next slide, please. So government of Karnataka has created Helix Biotech Park. If you see this journey of coming of Karnataka becoming a state to reckon with in terms of innovation, you say in 2013 we have government of Karnataka Helix Biotech Park, and then New Age Incubation Network were set up. This New Age Incubation Network where in the colleges, in the universities also, there are some centers where you can test your ideas. Bangalore Bioinnovation Center was started in 2015. This is a world-class center, very, very ambitious project of Government of Karnataka and Government of India, both DBT, to showcase India's capabilities and startup ecosystem and nurturing support, mechanisms. Then Karnataka's multi-sector startup policy was formed in 2015, which lays down so many incentives for the startups. And the Startup India was created in 2016, Center for Excellence 2019, and also the call for encouragement for COVID innovations. So all this has come up, and we can talk in detail more about this. If you have any question, you can definitely let me know, but I'll not go into the details of each of these schemes because it may take a lot of time. But if you have any question, you can just come to me. Next slide, please. Can you go to the next slide? Yeah. So vision of Karnataka's innovation framework is to create a world-class startup ecosystem through strategic investment and policy interventions, leveraging the robust innovation climate. The aim is to have 20,000 technology-based startups, including 5,000 product startups by 2025, 5 lakhs direct and 10 lakhs indirect new jobs in the sector, mobilizing around 2,000 crore funding for startups by leveraging the fund of funds. Why I'm saying this is that if this is a vision that you as an innovator definitely can, contribute to this envision, fulfilling these objectives of the government, and the strategies to have these goals fulfilled is through fostering strong partnership between R&D institutions and industry, which would mean that centers such as Rajiv Gandhi University of Health Sciences would like to, it would be very good if they partner with some industries like startups and all, and even the bigger companies. Providing early stage elevate funding, you must be knowing that government of Karnataka has created a grant fund called Ignition Grant, which we call Elevate 100, to select some innovations, and fund them up to rupees 50 lakhs. So you can also apply after this challenge. You can apply for funding, and Bangalore Bioinnovation Center can help you write such grants. And because we are implementation partner of Government of Karnataka to implement this Elevate program. We have also creation of incubation infrastructure through a PPP model. There is a social innovation challenge that keeps on happening every time, every year through Government of Karnataka, and you can also apply for that. Here the challenge is actually given, and then you have to apply, like the way you are applying for this COVID-19 challenge. Similarly, there are other theme-based challenges that are usually frequently given by government of Karnataka. There is a promotion of capacity building through exposure visits and workshops. Say, for example, we always take the startups to international events, and definitely you can also tap into that. Providing state support in the form of incentives and concessions. The IP, the last lecture we heard from Bindu about IP. So if you have IP, you can definitely tap into Government of Karnataka's program of refund of these IPs. The filing fees can be reimbursed. That's a very good program. Um, we have we have a startup cell which you can tap into always, and they can answer your question how to register a company. You have to register in Government of Karnataka's portal, and what are the benefits that you can accrue. Next slide, please. The ease of doing business in Bangalore is very good. Karnataka is very good. There is a startup cell with dedicated relationship manager for handholding and helpline for feedback. Startup portal for registration, application for incentives. Startup open house conducted through year of interactions, feedbacks, etc. There is a self-certification by registered startup and the labor laws like the building and other constructions, etc. and environmental laws. Next slide, please. Can you go to the next slide? Yeah, so there's a huge partnership with industry, like say setting up of incubation centers like Bangalore Bioinnovation Center, CCAMP, IKP, Eden, etc. So government of Karnataka has helped these incubation center. For Bangalore Bioinnovation Center, they have funded huge, and they are the owners of this. But CCAMP and IKP Eden also they have funded for substantially to create an innovation ecosystem. So all these centers, what they provide is the infrastructure, equipment, mentorship, funding, and networking facilities. Involvement of industry experts in review and selection of various initiatives is very prominent here, and we have a technical advisory resource group also, which not only selects the new ideas for incubation, but also gives mentorship and mentorship on timely basis. We co-host major events with industry associations like Association of Biotech-led Enterprises, and all are very deeply connected with us. So you as an innovator definitely should know all these programs that are happening and definitely tap into these resources. Next slide, please. See, these are Government of Karnataka funded startups, incubators, but there are many. I only named the major ones, which I have already said in the last slide: Bangalore Bioinnovation Center, Manipal GOK Bioincubator, CCAMP, IKP Eden, etc. Next slide. Partnership with academia through national, New Age Incubation Network 9 program is also very important, where within colleges you can get some assistance financially as well as mentorship. So first is financial assistance to selected ideas for prototyping and incubation for 1 year. These colleges can do that. They are funded by the Government of Karnataka. 50 new age incubation networks has to be established in this policy period. 20 colleges, 19 more colleges are being added in tier 2 and tier 3 cities. I'm sure that most of these medical colleges are eligible to apply, and if they apply, definitely this will help a lot of innovators like you who have applied for this program. Mentor Connect is there, and hundreds of students they go for working prototype, etc., and file new patents through these programs. Next slide, please. For setting up technology business incubators, we have a lot of programs, from Government of Karnataka. Say there are 10 plus technology business incubators that are operational. There is a funding support for establishing new incubators. Say, for example, Rajiv Gandhi Health University also can write to Government of Karnataka for financial help to create the incubation center within any college, any premise. And actually, I think we are in already talks with with the authorities to set up such centers, and Bangalore Bioinnovation Center would be very glad to mentor these centers. Why I'm emphasizing on such type of centers is because these will be one window support for the innovators like you, who can come and not only the infrastructure equipment, but other facilities like mentorship, funding, networking, etc. could be given to you. Right now we have incubation centers at IISc, MSR, CCAMP, KVFACU, Manipal, US Raichur, University of Agriculture and Horticulture Sciences, ICAR, IHR, Science and Technology Park, and Jain University, and many more are added. This is, I'm just giving you the 10, but there are more than this. Next slide, please. This is a very, very important program. See, even if you have a lot of ideas and you are coming up with a solution for COVID-19, ultimately, if you are coming up with a, say, diagnostic kit, or even a, a therapeutic or vaccine, etc., it requires a lot of funding support. Just an idea will not help you reach the goal. And either you have to raise some money through your own resources, or venture funding is a moot question, but you have to do a proof of concept. And for that, there is a funding support from Government of Karnataka's Elevate program. This is implementation. We are implementation partner with Government of Karnataka. And then 100 of startups are funded across the sectors through Elevate program. Now, this program is not only for life sciences or healthcare. This is also for other areas like IoT and IT and ICT, etc. But lot of startups in healthcare are funded through this program. So this is a very, very good program that you can tap into. Next slide, please. So, as I've said, there are multiple opportunities for the startup. Idea to POC Elevate program I've already covered. Seed fund is there, which is also available from central government, which is called as BIREC, seed fund called Biotechnology Industry Research Assistance Council seed fund. Bangalore Bioinnovation Center has received this seed fund, and it provides a capital assistance for, say, 30 lakhs for the idea to grow into a venture, or make it venture ready. This is a very good program. You can also tap into after Elevate or simultaneously. I would also like to say that there is a bio venture fund from Government of Karnataka, which is very, very important. This gives around maximum funding of 3.5 crores and minimum, of course, 1 crore. And it's a venture fund, so they will take some shares and equity in your company, or your, if you have not registered a company, you have to register a company if you want to take this idea forward into a venture. Okay, next slide, please. Grant Challenges, as I said, has been for, is a good program from Government of Karnataka, and it also provides funding support and all kinds of support to channelize innovations for social impact. And this process support the establishment and growth of startups. It started in 2016, and it has supported around 33 proposals until now. So mandate is defined, and call for proposals is given to the social in the media, and then shortlisting happens and selection of the initial funding of up to rupees 5 lakhs, and then there's a follow-up funding or pilot implementation. So a very good program. It's called Grant Challenges, and it's very similar to what we are doing right now with COVID-19 Innovation Challenge. The only difference is this is done by Rajiv Gandhi University of Health Sciences, and definitely it can be linked to the small funding from either Bangalore Bioinnovation Center's seed fund program, or Elevate program that you can apply. Next slide, please. This I have already covered. I would not go into the details, but I just wanted to showcase how many challenges we have so far done. And definitely, if you can see, challenge number 3 is effective delivery of healthcare products and primary healthcare services, etc. So one definitely was into healthcare, but definitely if there are a lot of applicants through this program, we can sensitize the government to again create another challenge for COVID-19, especially through social challenge, through grand challenges. Next slide, please. We conduct a lot of events, because this is very important. Startup companies must be given a platform where they can interact with the other stakeholders, mostly the bigger companies, the funders, the other stakeholders, incubation centers, all the stakeholders that are there in this, ecosystem must be made available in one under one, platform. So Bangalore Tech Summit, every year it happens. This year it's going to be in November. Hopefully, if the lockdown is over, then maybe physically. But if not, then we will hold it digitally, the way we are holding this conference. And then we'll have a startup pavilion there. There's a bioeconomy conclave also conducted through Association of Biotech-led Enterprises. Then Bangalore India Nano. And then in industry startup interaction meets and expo happens very frequently. And I think these are important events which you should connect to, because otherwise it's very difficult to take your idea to the next stage if you do not know what is the state of the art, what are other people doing, how can you find collaborators, how can you find partners. Next slide, please. Promotion and networking is, again, I've already described in the previous section, and but one thing I can say is global events such as Bio Korea and Bio US are also very important, which gives you international exposure. So if your ideas are very good, sometimes it may be meant for India in Indian condition, developed in Indian condition, but definitely if it is cost effective and technologically or innovation is very high, then it has a huge market outside also, although it may have developed in the constrained resource setting. Therefore, we definitely take you to the Bio US and Bio Korea. These are international events where you get international exposure. Next. So we have signed MOUs with JETRO, which is a Japanese industry organization in Victoria, Australia. We hold a lot of grand challenges in association with Victoria, especially in medtech device. And you all can also apply through this program with your COVID-19 challenge. There is a program called MedTech Got Challenge, MedTech Got Talent, which is we are implementation partner for Australian National Incubator. Next slide, please. So you are lucky to be in the best state for innovation, and I would like to reiterate that there is a synergy between government, industry and academia. There is a high level of involvement through a startup council under the guidance of Honorable CM of Karnataka industry representatives. Partnership with industry at various levels are there, channelizing innovations for social impact through grand challenges, transparent online process and systems in place, and the focus on multiple sectors in tier 2 and tier 3 cities. I think these are the overviews of the platforms that government has created for you innovators, and you should tap into this. Next slide, please. I think this is what I had to say. I hope I am on time. And if you have any questions, I'll be very glad to answer those questions.
Yes, we'll continue to send questions to you offline so that, we don't take more time. Ankita from your team is here, so she would like to just take another 2-3 minutes. So Ankita, would you come online quickly, please?
Hello, everybody. I'm Ankita. Yes. So I would not take much time. I'll just give a short introduction about Bangalore Bioinnovation Center. Bangalore Bioinnovation Center is a joint initiation of Department of Biotechnology, Government of India, and the Department of ITBT-SNT, Government of Karnataka. So this is about us. I'm just showing here what are our main functions and where we are located, etc. So Bangalore Bioinnovation Center is a part of Helix Biotech Park, which is located in the southern part of Bangalore, which is Electronic City Phase 1. We are in a cluster of academic institutes as well as industrial organizations. So in the institutional area support, we have Institution of Biotechnology and Applied Institute of Bioinformatics and Applied Biotechnology, and there is a Center for Human Genetics. And as an innovation and translational research, we have a Bangalore Bioinnovation Center. And as industrial area and future support for the successful startups, there is a lab zone, life sciences. The main motto is to develop the synergy between all these three important parts, that is academics, entrepreneurship, and the industries. So we are located in a 10-acre of campus with a built-up area of 60,000 square feet. We mainly cater to 5 different areas of life sciences, that is healthcare. We cater to medtech, biopharma, pharma, etc. And food and nutrition, environmental biotechnology, industrial biotechnology, agriculture biotechnology. So the main functions here I would like to say is providing the infrastructure. We provide the central equipment facility and the lab suites according to the requirement of the startups. We provide them the branding and networking support in majorly of 2 types. Basically, we sponsor them to present themselves and develop their networks and collaborations in international events like BioUS and BioKorea. And we also conduct our own events, workshops, demos, seminars, etc. that will help them to build their networks. We provide them the mentorships. There is a program called Karnataka Startup Advancement Program, KSAP Bio 50, where the 50 best potential startups are chosen and mentored by the experts. There's a funding. Bangalore Bioinnovation Center is an implementation partner for funding programs like Idea to POC, which is now Elevate. And we have supported 38 startups until now. So can we go to the next slide, please? So yeah, here are a few pictures that shows Bangalore Bioinnovation is a state-of-the-art infrastructure. So there's the laboratories that I'm showcasing here. So we have small suites, bigger suites, meeting rooms, etc. that can be utilized by startups. Can we go to the next slide, please? I'll just briefly explain the infrastructure and equipments. Like we have a cell culture facility. We have all the requirements like inverted microscopes, CO2 incubators, etc. Please just move the slides fast. This is a molecular biology facility, proteomics facility. Yes, I've listed the instrumentation. These details we can also find on our websites. So there's microbiology, where we have lyophilizers, laboratory hoods, microscopes, etc. Please go to the next slide. Yes, there's a flow cytometry, FC500, Beckman Coulter, and cell sorter, Biorad. Please, the next slide. So this is a histology lab, microtome, vibrotome, cryostat, etc. There's a fermentation facility where the fermenters from 1 liter to 15 liters are currently present, and we are also planning for 100 liters of fermenter in our upcoming days. Please go to the next slide. So yeah, in the other facility, we also have STP and ETP plants and DG and UPS backups, which makes sure that there's uninterrupted service we are providing to startups. We also have IP cell and environmental health and safety cell. Please go to the next slide. So yeah, innovation ecosystem development is one of the major motto for our things, our incubator, and we believe in developing the innovation ecosystem will help startups a lot, and we have developed several global linkages, like I think Dr. Jitendra Kumar already explained in his previous talk. So since we are running out of time, I'll just so this is where we signed the MOU in front of Honorable Chief Minister B.S. Yediyurappa. We signed MOU with Jetro, who is a export trade company. So this slide, this will show our national linkages, where we have connected closely with the National Defense Council, and we conduct a lot of workshops like artificial intelligence, machine learning, and IP, etc. So go to the next slide, please. So yeah, along with that, we also believe in expanding our regional linkages that will help a lot of student entrepreneurship kind of things, where we have signed a lot of MOUs. You can see here, IHR, University of Agricultural Sciences, NICHE, Government Ayurveda College, BMS, RV, etc. Also, we facilitate a lot of industrial visit for these students. So these are the awards and recognitions that we have received, like Top Innovation Enabler, Rendry Media Ecosystem Builder Award from Government of Karnataka, Innovative Biotech Solution Provider by Insight Success, and we are the Top Bio Incubator Award. We are very proud to say this. This is a national survey that happened, and BioSpectrum has given us this award. Please go to the next slide. I think, yeah, this I already mentioned that 38 startups have been already funded by us, as in we were the implementation partners for all these mentioned companies. Please. So here are current incubatees. I don't really want to go through each of their ideas and each of the descriptions, since we are running out of time. You can find these on our websites. Can you please move these slides faster? So yes, different areas that food and nutrition, environment, biotechnology. Yeah, we have already graduated around 16 companies. Yeah, this I would like to say that apart from the COVID-19 innovation challenge that's happening here, we also separately have a COVID-19 program that's battle against COVID-19. So we are taking the startups, we help them to prove their prototype and proof of concepts. And we had received around 120 applications. We've shortlisted around 60, and many researches are happening here, and we have already launched one product from our incubator SN Life Sciences. DCM, Honorable Deputy Chief Minister, had visited our center and launched this RNA isolation kit that was developed here. Please, the next slide. Yeah, these are the achievements. To list a few, we are 100% occupied within a very short span of our operations. And we have established the MedTech Center that has electronics prototyping lab, software lab, MedTech bench space. We also cater startups by giving the seed fund, which is from BIRAC again. So next slide. Yeah, we have 15 products that have a huge social impact are ready for launch. To name a few, there's artificial cornea, 3D printed skin, devices for detection for neuropathy, cancer, etc. So there are 20 patents filed and 15 more are in pipeline. And we have generated around 400 employments in our own generation, organization. This is our organization structure. I think we can skip this. So yeah, this is all about us. For all the students out here, and any entrepreneur here can reach us out. We are ready to help them however the way we can. Thank you so much for all the listeners. Thank you so much.
Thank you so much. So thank you, everybody, and I sincerely thank the participants who've been patient and being part of this program, which we started at 9:30. I'm sincerely, grateful to all of you all, and I hope you had a good time listening to our well-known speakers. And I sincerely thank our speakers for taking time out and being with us today morning. As closing remarks, I would like to call on Vishal Rao. Before I call on, one thing that I would need to tell all of you is collaboration is important, not just because it's a better way to learn. The spirit of collaboration is penetrating every institution and all of our lives. So learning to collaborate is part of equipping yourselves for effectiveness, lifelong learning in an ever-changing network economy. So from these presentations, we have all realized that we first need to find a purpose. After we find a purpose, we collaborate to innovate, and we fast track our innovation, especially for COVID-19. Dr. Vishal Rao, over to you for the closing remarks. Thank you, everyone.
Thank you, Anita. Anita, I was actually just reaching out to VC sir and Rajesh sir. I think they were busy. So but I think if they are free, I think I'll keep my fingers crossed so that they can come in and they can give some points. But what I want to tell you is, over the last couple of hours, I've been juggling between the sessions where the jury were sitting and analyzing applications, and to and fro between listening to our speakers. I was listening to Jitendra sir, I was listening to Shyam Vasudeva Rao sir, before that Bindu. It's been a very interesting blend, and I tell you, seeing on both the sides, and I've been juggling between all of these. The most interesting thing I must tell you all is today, on the other side, and I'm saying these particular webinar sessions have been reaching out to, I don't know, thousands and thousands of people, because today we've been on live on YouTube, on other social media platforms. So the messages that the mentors and speakers have given today, I think, is immortalized as the first milestone. Second, what I saw in the pitch session, because I was very excited to know how are people pitching, how are students pitching, and I'm going to tell you one or two which I just listened to, which are absolutely inspiring. I mean, I couldn't believe they actually are doing all this. So there was a group of first year students who are actually talking about some very advanced AI solutions, looking at environmental factors, looking at this and looking at analyzing COVID. We had people talking about mobile apps. We had people talking about sterilizing PPEs. We had people talking about some very interesting new concepts, which I would not have conventionally thought about. What amazed me also is there were people from, like, one team had people from different corners of the state coming together and pitching online in continuum through the online platform. I mean, these are things which we would not have thought of. There was just a group right now, and these two interns are telling us that they have actually started their entrepreneurial journey from medicine, and they are setting up a platform to actually take education to the rural background. You know, I remember when we started the discussion on the topics for COVID, we were talking about whether would there be anybody talking about community, would there be anybody talking about education and things like that. And the ideas that we've heard today have been absolutely astounding. And again, a proof of our pudding to say that youngsters can actually lead the world much better. The way these people are presented, I mean, the first year students with minimal idea on COVID, the confidence with which they presented things today, I'm sure with right mentorship in a month, they're going to give us more meaningful products. So I think I leave with these marks to tell that I thank the Rajiv Gandhi University for all the support, especially our Honorable Vice Chancellor, our Registrar, Kapashi sir, our faculty, Professor Rajesh, Dr. Venkatesh sir, and all the rest of the Rajiv Gandhi University back-end team that have been holding on to this. Our partners, Bangalore Bioinnovation Center, Indian Institute of Science, Triple IT, Anita, GHA, of course, you guys. Then we have Pencil Box, that was our designer. We had Keywings helping us with drafting the entire thing. Microsoft team, Gangadhar actually hosting the entire platform for apps and so I think I will leave with these thoughts to say that it's been a great inspiring, a lot of great learning for us mentors. And with this, I think we are sure to make this into a very regular event and keep this show going on regularly. Thank you very much, one and all, for spending your time. I'm sure there's been a lot of questions that are still unanswered, a lot of discussions that are incomplete. What we want to assure you is, if any one of you feel that you've not been fully heard, please write into us, continue the communication channel so that we keep doing this. What we've also learned from a lot of these ideas is that we will continue to mentor all of them, whoever needs help, and the Rajiv Gandhi University is assuring that we will continue to support guidance for not only winners, but also the people who participated, who needed guidance, who needed simple connections, and continue to move this ecosystem forward. And in a month later, I'm sure when we inform and update the Prime Minister on this, he will be more than excited to hear all the great achievements these youngsters have done and inspired others. Thank you very much.
Thank you, everyone. Thank you.